Rajiv Sharma, Dr. Suresh Joshi, Dr. Suresh Patil, and Dr. Beena Apothikar, three of our very, very dear friends from Vasai, Nadasapara, Virar, are today going to present. And to present all this, we have our very charming Dr. Manveen Patil. Dr. Manveen Patil is a pediatric cardiologist, and there was a time when we were struggling to, find a cardiologist, let alone a pediatric cardiologist in Vasai. And now we are blessed because Palghar district has two pediatric cardiologists, Dr. Manveen, and we have a very, very competent cardiologist who's going to be our speaker today. Dr. Manveen has come from North India to settle in Vasai in Virar, and today she's going to moderate the show. She's the host of the show. And on behalf of Indian Academy of Pediatrics, I welcome all of you today. A hearty welcome to all of you on a subject that is very dear to our heart, about the matters of the heart. So over to you, Manveen. You can begin your presentation and your introduction.
Thank you, madam. A very warm welcome to everyone gathered here on this platform today. On occasion of Doctors' Day, which is celebrated on 1st of July nationwide, so Palghar Academy of Pediatrics has organized this special webinar to discuss about all the matters related to the heart. How to keep this special and very important muscle fit and strong, how to alleviate stress from our lives, how to modify our lifestyle for prevention of diseases. So, Dil Ki Baatein Karne ke liye, we have three very special speakers whom we would like to call as our three Dil Wale for today. So, we thank all three of them for joining us today and for sharing their knowledge and wisdom with the audience. So, to introduce our first speaker, Dr. Rajiv Sharma, we would like to start with a song with a twist, which I'm sure everybody knows this song. So, Dil ka haal sune dil wala, दिल का हाल सुने दिल वाला, सीधी सी बात न मिर्च मसाला, कह कर रहेगा कहने वाला. So I invite Dr. Rajiv Sharma, who is an eminent cardiologist practicing in Vasai Virar region in Cardinal Gracious Hospital in Vasai. He is a member of the American College of Cardiology and Society for Cardiovascular Angiography and Intervention in the United States. He's been a gold medalist and topper throughout his training through the esteemed and prestigious institution of St. G.S. Medical College and KEM Hospital in Mumbai. His special interests are in transatrial interventions and emergency coronary interventions. He has many international and national publications and textbook chapters to his credit. So without further delay, I invite Dr. Rajiv Sharma to start his presentation. Welcome, sir.
Yeah. Thank you for the kind introduction. See, the problem in Vasai Virar is of electricity. So in case I disconnect, I will definitely reconnect soon because the hospital has a generator.
Excuse sir, your screen is little tilted.
So yeah, can you rotate your device?
Yeah. So there is left axis deviation. Now it's fine.
Yeah. Yeah. The problem is, the speaker, my voice is audible clear, right?
Yes.
Yeah, so sure. Just pardon me in case there is a power failure. We have a generator backup, but it takes that 1 minute. So if it disconnects, I'll reconnect definitely. And I have a long and exhaustive talk actually. So I will try to cut it short and we will have more time for discussion because many doubts in everyone's mind. So we will try to clarify them one by one. I'm sharing my presentation now. Okay. Okay. Is the screen visible? Hello?
Yes, sir.
Yeah.
Yes, sir.
So today we are discussing a topic on more of preventive aspects. What we see is a lot of our doctors, our fellow colleagues are suffering from heart diseases, and we are experiencing a really bad tsunami wave of cardiovascular disease in our country. What we see is that India has a younger population. Our cardiovascular disease happens 10 years earlier compared to our Caucasian and US counterparts. And we being born of South Asian ancestry, we have really bad genetics, and we are at a 3 to 5% higher risk than those Latin American or those Hispanics. So we are blessed with really bad genes. So doctors, we all know, have a worse lifestyle. We tend to have half knowledge about a particular subject, and we assume that we know everything about a subject. We tend to be ignorant. We tend to focus more on practice and patients, very little time for ourselves. And as a result of that, we suffer equally as well. We lost a dear doctor during COVID times. He was an ischemic heart disease patient, and 2020 we lost sir at a fairly young age of 65 years. So what we'll be discussing is from the preventive perspective. So as the American College has made these 8 essential things which are very important for heart health, and we should be focusing on them. So the green suggests the food, so proper diet. Second, blue is I will go clockwise. So second is exercise. Third is control of blood sugars. Fourth is a check on the body weight. Fifth is a check on lipids. Sixth is a check on blood pressure. Seventh is no tobacco smoking. And the eighth, which is added now, last week, is sleep hygiene. So till now, it was the essential 7. Now we have added sleep in that, as we realize that improper sleep or sleep less than 6 hours, or in fragmented sleep, inadequate restful sleep is also contributing to the tsunami of cardiovascular disease. So now, how do we evaluate a patient? The doctor comes to me, asks me, doctor, should I take statins? Should I take aspirin? My family history is of cardiovascular disease. What is my risk of developing a major cardiovascular event? A cardiovascular event could be a heart attack. It could be a stroke. It could be a renal artery stenosis. It could be a peripheral vessel disease. It could be eye manifestation. So atherosclerosis of the eye causing CRAO and CRVO. So how do we evaluate a risk? Risk is evaluated by use of a simple calculator available online. It is called as ASCVD risk score. Now this is done on American population. This is not for Indian population. But always believe that whatever is done for Americans, we are at least 3 times higher risk compared to them. So our risk is going to be much more than what this actually calculates because of our South Asian ancestry. Now, South Asian ancestry includes 5 countries: Pakistan, Bangladesh. We include Nepal, India, and Sri Lanka. So these 5 countries have almost similar genetics. China is very different from us. In fact, they have a lower risk compared to the native Americans. So what we do is, patient comes between age 40 to 75. We go online. We use this calculator and we calculate the 10-year risk of a cardiovascular event. If a younger patient comes, ki mummy ko heart attack ho gaya, what should I do? So if it's a patient between 20 to 39, we see our traditional risk factors once in every 4 to 6 years. So we start checking his BP once. We do a baseline lipid profile. In fact, pediatricians are also recommending as early as the age of 10 years for a screening baseline lipid profile. Now, based on this ASCVD risk score, we divide the patients into low risk, which is score less than 5%, borderline score, which is score between 5 to 7.5%, intermediate score, which is score between 1.5 to 20, and high score is about 20%. Now, depending on the score, we decide whether the patient is a candidate for primary prevention by use of statin therapy, etc. Now, if a patient has intermediate score, now he says my risk is 7.5 to 20, should I take a statin? Because statin is causing diabetes. Statin is blamed to cause Alzheimer's. Statin is blamed to cause myalgias. Statin causes hepatopathy. So should I take a drug because I really don't have a clearly high risk? So in those patients, what we do sometimes is we advise them a CT calcium score. So we do a CT scan based coronary calcification score. And if the score is more than 100, we push the patient for statin therapy. If the score comes less than 100, we advise the patient may consider statin. If the score is 0, we advise the patient that they may safely not take statin therapy. Now, if a young patient between 20 to 39 comes with us, we can also do a lifetime risk rather than a 10-year risk. So this is the kind of a screen that you see online, ASCVD risk estimator plus. What they ask you is the age, the gender, the race, whether we are white, African American, others. So we put others in India. We see the systolic blood pressure. Now, how BP should be measured, we'll discuss that. Diastolic BP, we put the total.
Sir, you are not audible.
Yeah, I think we should request him to put his video off.
And make full screen, I think.
Yeah, I think he's presenting it from his mobile.
Acha.
Or a power failure, maybe, as he was saying.
I think he has left and he might join again. I think there are enough risk factors for all of us to consider.
I think he's joined back.
Yeah. Dr. Rajiv, we can't hear you if you're joined back.
Sir, are you on mute?
Hello, am I audible?
Yeah, Rajiv, can I request you to put off your video? That will increase your bandwidth. You can speak, but your video off.
How do? Okay.
Yeah.
Yeah. So
Okay.
am I audible now clearly, madam?
Yes. And also, is it possible to make it full screen?
I don't know why it's not getting full screen, madam. I don't know. Just
okay,
a minute.
No problem. You can go ahead.
Yeah.
Yeah, I think now it's.
Is it better now?
We can't see anything.
Hello?
Yeah.
No, sir.
Is it better now?
No,
we can't see anything. It's a blank.
Now it's visible.
Yeah. So I have made it a full screen and I am audible, I guess, right?
Yes, sir.
Yeah. So now what are the risk factors for coronary artery disease? We did discuss those 8 risk factors, which was improper diet. The second was poor exercise. Which includes sedentary lifestyle and things like that. The third we discussed was diabetes. Fourth was hypertension. Fifth was dyslipidemia. Sixth was obesity or adipotoxicity, as we so call. There was seventh was tobacco consumption, and eighth was improper sleep hygiene. Now, when a patient comes to us, he may be saying कि मुझे तो इसमें से कुछ भी नहीं है. Why did I still get an MI? Why did I get a stroke? Or a doctor comes to me, my papa had a stroke, I don't want to die. Doctor, I don't want to die. There are many patients who come and ask me this question. I don't want to fall sick. I don't want an event in my life. So what we do in such patients is we see other risk enhancing factors. So what are the risk enhancing factors? So family history. If there is a premature atherosclerotic event in the family, it is a risk factor. Premature is male less than 55, female less than 65. Then we see something called as genetic dyslipidemia. Now, genetic dyslipidemia is either homozygous or heterozygous. Heterozygous is the most common inherited problem. And if the LDL cholesterol is above 190, or if the LDL cholesterol is between 160 and 190, and the non-HDL 30 above this, then it is a primary dyslipidemia. So these are risk enhancing factors. The third enhancing factor is metabolic syndrome. As we all know, metabolic syndrome X is a constellation of 5 problems which comes with obesity. So what we see is obesity, insulin resistance, elevated blood pressure, patients with lupus, patients with rheumatoid arthritis, HIV, So then what we see is in women, two conditions are very important. One is pregnancy-induced hypertension. If there is a history of PIH, it is considered as one of the risk factors. Premature menopause, so menopause occurring before the age of 40 is considered important. And the third thing is PCOS is considered important. South Asian ancestry is a high-risk population, as we all are. Then what we see is lipid markers. In lipids, what we do is triglyceride estimation. If it is more than 175 at a non-fasting level, random triglyceride above 175 is abnormal. HSCRP above 2 is a higher risk factor. Elevated lipoprotein small a, we measure it once in lifetime, and if that value is above 50, it is considered to be a patient high risk, and we try to give the patient statin therapy if the LDL is borderline as well. Elevated ApoB more than 130 and triglyceride above 300. Ankle brachial pressure index of less than 0.9. Also, what is there is erectile dysfunction in men. So if erectile dysfunction history is there, it's a patient with a risk enhancing factor. So I hope the risk factors are clear.
What is ankle brachial index?
Yeah, what is ankle brachial index is what we see is the pressure in the lower limb, blood pressure. See, there is something called as peripheral amplification of blood pressure. So as we go away from the heart, the blood pressure is higher. So what we see is the lower limb blood pressure is more than the upper limb. In us, the lower limb blood pressure is more than the upper limb. So if we have peripheral vessel disease, if aorta is abnormal, iliac branches are abnormal, femorals, those common femoral, superficial femoral, or the popliteal ones are diseased by atherosclerosis, the lower limb blood pressure will be lower than the upper limb blood pressure. So if you see the ratio of lower limb BP to the upper limb BP. So if the lower limb blood pressure is low, it is an indirect surrogate of peripheral vessel disease. So we do measure ankle brachial index also. A patient comes to us with claudication, always see the ankle brachial index before doing a Doppler. So if the ABI is normal, it is pretty claudication, not vascular claudication. So I hope the risk factors are clear. Anyone has anything to discuss here?
No. No, it's clear, Raj.
Yeah. So in diet, what we do, I'll go a little fast because my presentation is really big. It's a huge topic.
Yeah.
So in diet, what we suggest is focus on the quantity, restrict the calories to 1600 or to 3000, depending on the weight, activity, whether pregnancy or no. Focus on the quality of diet. So more of raw, less of oil, less of salt, less of sugar, less of refined carbohydrates, ultra refined carbohydrates like maida. Sugar sweetened beverages should be completely replaced with water. Red meat consumption should be replaced by preferably fish consumption or white meat like chicken breast. Red meat should be consumed as little as possible. The further the genetics of the food we eat from our genetics, the better the food is for us. So we don't consume humans because they have the same genetics. Then next is red meat. So don't consume red meat because it's closer to our genetics. Then comes white meat, which is a little further. Those chicken are a little further genetically from us. Fishes, being sea creatures or water creatures, are genetically distinct, and water and plant is distinct genetically completely from us. So the further the genetics of the foodstuff we eat from us, the lesser is the grade of inflammation in our body. Lesser the inflammation, lesser is the stimulus for atherosclerosis. So these are basic diet instructions that we give. Time restricted eating is famous by the Dikshit diet. So fasting and in the remaining 10 hours, finish off all the 3 meals and engage the patient in a diet program. This is what we do. So more fruits, vegetables, whole grains, nuts, legumes, seeds and fish. Mufa pufa rich food more. Intake of fiber should be there. So raw fruits are better than fruit juices. We should replace fruit juices with fruits completely.
Rajiv,
Reduce the intake
excuse
of
me, but I think
fatty acid.
Dr. Beena is going to cover all this.
Yeah. So the second thing we focus on is exercise. Exercise, again, Beena madam's expertise. So 150 minutes of exercise of moderate intensity or 75 minutes of vigorous intensity. Don't do only cardio. Along with cardio, there should be focus on resistance training exercises. I think Dr. Beena Madam is going to talk about it.
Yeah.
Brisk walking is one of the simplest exercises. Less than 5,000 steps a day is sedentary. Try to have a target of more than 10,000 steps a day. Dyslipidemia, what we do, I'll simplify this extremely complex slide. So in dyslipidemia, what we do is first we measure LDL cholesterol. LDL is the first target. Depending on the risk, we give a target of LDL 100, LDL 70, LDL 55, LDL 40, or LDL 30. We are all born with an LDL of 30. So we can go LDL as low as 30. The lower, the better. So depending on the risk, we calculate LDL. The second target after LDL that we give is non-HDL cholesterol. Non-HDL, advantage of non-HDL is you can do it in fasting state. And the target for non-HDL is 30 above the LDL targets. The next slide, I'll tell you how we calculate the risk score, which we did calculate, and how to give statin therapy based on that. Lipoprotein small, if it is elevated, it is counted as a risk enhancing factor. So consider statin therapy in patients with elevated lipoprotein small a, even if they have borderline LDL values. Familial hypercholesterolemia, when the LDL is above 190 plus xanthomas, should be treated with high intensity statin therapy. If they are above 150, ideally the triglyceride level should be less than 100. If statins are not acceptable to the patient due to myalgia, hepatopathy, or something, what we can do is ezetimibe. Ezetimibe is reducing LDL. Or there is a new drug called as bempedoic acid. Bempedoic acid works at the hepatocellular level, does not work at the myocyte level, and reduces the LDL cholesterol by 18%. The third drug that we can use is PCSK9 inhibitor. If statin is not acceptable to the patient, if bempedoic acid or if ezetimibe is not acceptable, what we do is we use drug called as evolocumab, which is a monoclonal antibody against the PCSK9 hepatocyte marker. And it is fantastic because it reduces the LDL cholesterol by almost 50%. It is injectable. It is expensive. I use it in patients who don't achieve their LDL targets after angioplasty. The per month cost of the injection is 36,000. One injection costs 18,000, and we have to use it twice a month. Research is going on inclisiran, which is a once in 6 month injection, which will soon be available in the market. UK, they are doing it as a community measure. Then we focus on triglycerides. Triglycerides, ideally, I told you, should be less than 150 and ideally less than 100. For triglyceride, phenofibrates work really well. Micronized phenofibrate has less of myotoxicity, so the muscle pain is less. Also, omega-3 fatty acids work really well for hypertriglyceridemia. So in a isolated hypertriglyceridemia, first step is lifestyle changes. As we discussed earlier, lifestyle reduces triglycerides by 30%. If lifestyle is unable to meet the targets, what we do is phenofibrate, or we use omega-3 fatty acids. So eicosapentaenoic acid is one of the omega-3 available now. It is 26 rupees for 1 gram. Ideal dose is 4 grams per day. So it's 104 rupee therapy per day for the patient if you are using eicosapent. Comparatively, phenofibrate is less costly and works really well, barring the muscle side effects of phenofibrate, which are alleviated by using micronized choline phenofibrate.
Excuse me,
if still it is high, then there is a
Dr.
drug called as...
your slides are not moving ahead. We are seeing...
Sorry, hello?
Yeah, your slides are not moving ahead.
Yeah, I am. Yeah, this is... Madam, this is a big slide, so I'm just summarizing what is written in that slide.
Oh, okay. I'm sorry, yeah.
Oh, yeah. So I think I have covered most of the lipid things now. So first target is LDL. Second target is non-HDL. What we also see is lipoprotein small and triglycerides, and how to approach them also I have discussed. So if the patient has LDL above 190, directly put the patient on high intensity statin therapy. If the patient is a diabetic patient, irrespective of LDL value, patient should be on a moderate intensity statin therapy. If the patient, if there is a younger patient, what we do is if it's a primary genetic dyslipidemia, we put the patient on statin therapy. And if the risk score is about 20, high intensity statin therapy, risk 7.5 to 20, intermediate risk patients, we see the In lower risk patients, we emphasize more of lifestyle changes. Borderline also, we consider statin only if there are risk enhancers. So based on the 10-year risk, based on diabetic status, based on genetic dyslipidemia, take a call on statin therapy. Okay. So the next thing, what is important in prevention is diabetes. You know, diabetic patients at a high atherosclerotic risk.
Sir, you're not audible.
Dr. Rajiv, we cannot hear you. I think he has lost connection. Connectivity is a big issue. Now I'm so scared. I even don't want to measure my cholesterol and lipids.
Don't worry, you're fit, Anjali.
Yeah.
I've seen the way you work out.
Okay, thank you.
So yeah, we have discussed about diet, exercise. We have discussed about dyslipidemia in detail. We went on to diabetes now. Diabetes, I told the target of glycosylated hemoglobin is 7 and 8 or 9. In fact, up to 9 also in a very elderly patient. Intensive glucose control is the way to go actually. Drugs for diabetes, metformin is always the first choice in addition to lifestyle. And the second group of drugs are now cardio-safe drugs which are to be used. So good old thiazolidinediones, the good old sulfonylureas are really not good drugs. So what we do is SGLT2 inhibitor. We have 3 SGLT2 inhibitors available with us, which is canagliflozin, empagliflozin, and dapagliflozin. The second group of drug that we can use is GLP-1 agonist. In GLP-1 agonist, the advantage also is of additional weight loss. So basically in diabetes treatment, what we do is first drug is lifestyle changes plus metformin. Second step is we have SGLT2 inhibitor or we use GLP-1 agonist. If the patient is non-affording, only then we give the patient sulfonylureas. And thiazolidinediones have an advantage, but because heart failure, fluid retention, so we avoid using thiazolidinediones. So we individualize diabetes treatment as per the patient. And so to summarize diabetes, what we do is good glycemic control, use cardio safe proven drugs, and focus on aggressive reduction of other risk factors. Hypertension, most important thing is we should define it properly, measure BP with the right instrument in the right way. Patient should be sitting on a chair. The feet should be touching the ground. The arms should be rested. There should be no talk between the person who is recording the BP. The patient should have passed urine or had food half an hour before. He should be in a relaxed, calm environment, sitting on the chair for at least 5 minutes before we measure the BP. So proper technique of measuring BP is important. If proper technique cannot be followed, give the patient a BP instrument for home BP measurement. Use oscillometric machine rather than the mercury machines. Doctor should not measure the BP. The nurse should be recording the BP. So that is what we recommend. If the BP is elevated, the drug of choice usually nowadays is a combination therapy. So we use a combination of telmisartan or olmesartan and amlodipine or nifedipine, whatever combination is easily available. Combination therapy is recommended because by using a combination therapy, what we do is we reduce the side effects of the larger dose of the single drug. Other combination that is very good is combination of ACE inhibitor ARB plus a diuretic, chlorthalidone group of diuretic. So after lifestyle changes, if the BP still remains high, then combination therapy of drug is recommended. The BP target for everyone is less than 130/80. So this is basic simplified algorithm. So accurately measure the BP. I told you the points. See the risk. Have good target of BP. BP target for everyone should be less than 130 and 80. We use a combination of ARB plus amlodipine or ARB plus diuretic chlorothalidone group. And then depending on how the BP control is achieved, we use further drugs. The obesity metabolic syndrome is a big problem. We aim for we aim for a body mass index of less than 25, and we have to use motivation, we have to use lifestyle changes, we have to recommend the patient drugs which can reduce weight. For example, metformin causes a bit of weight loss, SGLT2 inhibitors cause weight loss, GLP-1 agonists cause weight loss. There are those specific obesity drugs like topiramate, anti-epileptics which cause weight loss, they call anorectics. And bariatric surgery also may have to be considered if the patient has a lot of risk factors with obesity. Other risk factors for atherosclerosis are old age, which we cannot reverse. Does old age mean that you don't treat a patient? No, it does not mean that. Does it mean you don't give statin therapy? No, but you have to start at a lower dose, go low, start slow, go low in old age. Don't be very aggressive on sugar targets. Don't be very aggressive on lipid targets. And the BP targets as well, because coronary perfusion is depending on diastolic blood pressure, and a diastolic BP of above 70 is recommended for optimal coronary perfusion. Ethnicity, we are South Asians.
Yeah, just a question, Dr. Rajiv. What is old age?
Yeah, above 75 now.
Okay, fine.
Yeah, so we changed it from 65 to 75 because a lot of people are our age is increasing, our longevity has increased. Ethnicity, we can't really help. We are South Asian, so we are assumed to be of high risk unless proven otherwise, unless the patient has a really good lifestyle and we have no stress, which all of us has as doctors. Gender differences, women assume they don't get atherosclerosis, they're happy about their estrogen function, which is not actually true. We see a lot of young women with atherosclerosis, aggressive atherosclerosis, repeat revascularization need also. In fact, it might be surprising to you that if you have a diabetic patient, female diabetics have worse outcomes than male diabetics. So that is what we see. After menopause, all the advantage of estrogen is lost, and the risk parallels to that of men. Women who have premature menopause are at a very high risk of atherosclerosis. Also, women with PCOS have a big problem because there is a lot of insulin resistance, adiposity, adipotoxicity, insulin resistance. What we also see is hypertension, hirsutism, all the features of testosterone also come. So the PCOS females are also at a very high risk. Also, women tend to ignore their health more than men. Women come to us late with MI, and as a consequence, what I always see is women having worse outcomes than men in atherosclerotic events. Also, the care given to a woman is always partial in Indian society. Maybe different for us doctors, but overall, women have a worse outcome when they get an event. So, female population has to be dealt with sensitively, and their endocrine function, their history should be taken in detail about menopause, about PIH in pregnancy, about kids, how they were born, because a normal delivery rules out a major valvular heart disease or congenital heart disease at her younger age. So a lot of history taking has to be done. Obstetric history has to be taken in detail, and a female has to be sensitively handled. Emotional aspects of women have to be looked into because stress is a major factor, as Dr. Suresh Patil sir will be discussing. So thrombosis and smoking. Smoking is a killer. Those e-cigarettes nowadays, this younger population smokes, has a little lesser risk, but it is not safe. Cigar smoking, royal people believe they don't get atherosclerosis by smoking cigars. It is wrong. Cigar smoking is equally bad. E-cigarettes are also bad. Little lesser than cigarettes because the toxins are purified in e-cigarettes, but equally bad. So smoking, what happens due to smoking is thrombosis cascade gets accelerated. Now, which are prothrombotic patients like patients with protein C, protein H deficiency, antithrombin 3 deficiency, patients with antiphospholipid antibody syndrome, patients with hyperhomocystinemia, These are the patients at a higher risk of thrombosis. Smoking also triggers thrombosis. So if a patient has a thrombotic episode, we have to evaluate for thrombophilia profile, and accordingly, anticoagulant management has to be titrated and modified. Kidney disease, in general population, the leading cause of death is cancer and cardiovascular disease. In kidney patient, the leading cause of death is cardiovascular disease. They don't die of kidney problems. They die of cardiovascular disease. 75% kidney patients, CKD patients die of cardiovascular death. So kidney patients, the targets for lifestyle modification, the targets for statins, targets for BP management are very, very stringent, and they have to be dealt with appropriately. Kidney disease means, for everyone's information, even albuminuria is counted as CKD in diabetic patients. So don't take microalbuminuria lightly. Don't take elevation of creatinine, fall in GFR lightly. Fall in GFR below 60 is a risk factor for cardiovascular disease. So please advise the lab to calculate the eGFR and tell you the eGFR value. Genetics and family dyslipidemia I have discussed. If the LDL is above 190 with tendon xanthoma, high intensity statin therapy. If the LDL is between 160 190 with a family history of premature event or tendon xanthomas, you have to treat the patient with aggressive statin therapy. He's only 10 years old, Rajiv. Should we still treat? Yes, we should still treat. My teacher has done an angioplasty of an 8-year-old girl, and one of my colleagues has done an angioplasty of a 9-year-old girl as well. So familial dyslipidemia is a different ball game altogether. We have to do genetic workup and take a call accordingly on which therapy, how aggressive, PCSK9 need or no, and take a call accordingly. Psychological aspects, social aspects, and sleep are very important. Psychological stress, which we all doctors have all the day around, has a major 2.2% enhanced risk of atherosclerotic event. Social support is very important. Bonding together, associations like the IAP has organized this program, goes a long way in longevity. Sleep hygiene has to be very nice, and minimum 7 hours of sleep is recommended. Let those successful people give a lot of slogans online that if you sleep 1/3 of your life, you will achieve nothing. It is wrong actually. If you sleep 1/3 of your life, 1/3 of your life will be enhanced. So sleep should be at least 7 hours. 7 to 9 hours is good sleep. Younger children should be given even better, longer duration of sleep. And social determinants of health are very important. So at the individual level, at the interpersonal level, so husband-wife relationship, friend relationships, interpersonal conflicts are major causes of events. I see that a lot of time. Institutions like hospitals should have a doctor's lounge. Unfortunately, what we see is those doctor lounges are reducing in size. Hardly there is no bed also for a patient, for us to go and recreate and lie down. In fact, when I joined Cardinal, there was a huge doctor's room there. Now there is no doctor's room. It's just a changing room. So institutions like Google work in favor of the employees. So institutional level organization also should be better. Community level, there should be these community level things I see very well in Vasivira, particularly in the Catholic community where church helps, church organizes programs, church plays a good role in reducing psychological stress, and those confessions are available for the community to have their grievances shared. So structure and systems have to be managed. Social relationships, community interpersonal relationships have to be dealt with very importantly. Which are negative psychological factors is anxiety, anger. Anger has to be managed. Chronic stress, if you don't enjoy your job, social stressors, financial pressure, pessimistic attitude, ye kuch hoega nahi, mar jayega, all that negative thoughts, depression, early morning awakening, things like that have a negative impact on cardiovascular health. Positive thinking, mindfulness, gratitude. A gratitude log goes a long way. So every day in a diary, you can mention 5 good things that happened to you. You can speak them out loud when you're laughing, when you're bathing, when you're doing any other activity. You can just have gratitude to the Lord by for whatever we have. We all are blessed actually as doctors. And a sense of purpose. So Ikigai is very important. We all should have a sense of purpose of what we want to achieve. Social support I have discussed. So Ikigai, the book is wonderful. And how to live 100-year-old. Stay active. Don't retire. There is no concept of retirement. In medical practice, you should never retire. The seniors of the group have a big role and responsibility in guiding us juniors. Their observation skills are excellent, and we all can learn a lot from our seniors. Take it slow. Take a pause before you react. Don't fill your stomach. So the first society signal, stop eating, give that dessert away. Gentle daily exercise. So it's not that you do not to go in a gym and build your body, but do focus on cardio and resistance. Beena madam is an expert in that. She'll be letting us know in some time. Connect with nature, something called as a forest feed. So what we can do is the greens, they reduce the stress by a significant amount. So take a trail in the nature, go to national park, Tungareshwar, etc. Be amongst the greens. Live in the moment. Live in the moment is very important. No past, no carrying grudges, no thinking about the future. Nothing is certain. An event we may die the next moment. Surround yourself with good friends, not competitors, not those bitchers. Have good friends. So this also helps in longevity. Treat others as your own brother. Don't. That negativity should go away. No one is competing with anyone. We all have sufficient food on our plate. Follow your passion. What ikigai is basically thing that wakes you up in the morning. So follow your ikigai. Smile is a wonderful way to relieve your stress and be grateful to the Lord. Gratitude log goes a long way in living long. So this is a nice quote from Durga's secret book. I do read a lot of parallel stuff. So it says that nothing lasts forever, nothing ends forever. The way Durga comes and goes, she comes back the next year. Everything comes back, everything goes back. It grants solace and hope to the villagers who are facing sorrow that she will come next year. It also warns those who are enjoying fortune that she will be going after 10 days. So in our practice, we should remember nothing lasts forever. There is nothing like mera patient, tera patient. No bitching around, no belittling your colleague, not being insecure. Abhi kaam kam hai, slack hai. The day there 2 days patients are less, all these doctors start writing on multiple groups. Arey slack hai, dhanda manda hai, practice to band ho gaya. I don't know where this insecurity comes from. So this message is very nice. Please remember Durga and what happens to Ganpati festival as well. We bring him with full fervor, festival fervor, and he goes after 10 days with a lot of sorrow and regret. But he always comes back the next year. So similarly, practice bhi aayega, kidhar jayega. And remember, mind is a beautiful servant, but if you allow it to become a master, it's a dangerous master. I think Suresh Patil sir is an expert in that. Thank you so much for the patient listening, and I will be very happy to discuss anything that comes along.
Great talk, and Ikigai was the best.
Thank you,
Rajiv, Ikigai was the best.
Thank you, madam.
Thank you, sir, for the wonderful talk. It was a comprehensive talk and we really enjoyed it. And now moving on to the next speaker. So to introduce him, I'm sure many of us in our routine practice or have got patients or even family members coming to us with the question, मुझे नींद ना आए, मुझे चैन ना आए, और दिल हूं करे, घबराए. So, but worry not. To help us answer this question of how to de-stress ourselves, we have our second speaker, Dr. Suresh Patil, who is a renowned psychiatrist, psychotherapist practicing in the Palghar district. He is the founder and owner of 42-bedded Vibhas Psychiatric Hospital in Virar West, along with 3 other branches of clinics at Virar, Nalasopara, and Vasai. He has many national and international publications to his credit, and he's been topper throughout his training in psychiatry. I welcome Dr. Suresh Patil to join us today. Welcome, sir.
Good afternoon, everyone. Thanks to Palghar Pediatric Academy. It's a wonderful things. As Dr. Raju said, gratitude is the first thing, the best thing to prevent the cardiological disease. I start my presentation with gratitude. ये दिल दीवाना है, टॉपिक किसने रखा मालूम नहीं है, लेकिन जिसने टॉपिक रखा उसका दिल दीवाना है. मैंने सोचा ये दिल दीवाना है तो दीवाना कहाँ से आया, तो मुझे कुछ पेडियाट्रिस्ट हमारे जो है वो धर्मेंद्र के जमाने के नजर आए. यानी अपनी लता दीदी और रफी का एक पिक्चर था धर्मेंद्र का, उसमें एक गाना था ए दिल दीवाना है। उसके बाद मुझे कुछ अमित सावंत जैसे नए पेडिट्रिशियन दिखाई दे, दिल दीवाना, वो शाहरुख खान वाला परदेश मूवी। लेकिन कुछ भी हो, अपना दिल तो दीवाना है सबका, मेरा छोड़ के, मेरा तो दिल पागल है। मुझे लगा कि सर दीवाना है, मुझे क्यों पकाया, मैं तो दिल पागल है का डॉक्टर हूँ। लेट्स टॉक अबाउट द दिल दीवाना है। सो दिल कब टूटता है? काय पाऊस, काय तुंबलेलं पाणी, काय ते क्लिनिक समज ओके मध्ये आहे. आजचा सकाळचा फोटो आहे माझ्या क्लिनिकच्या बाहेर एवढं पाणी भरलं होतं ना, तब दिल बहुत टूटता है. तो व्हाट वी कॉल्ड इट एज अ स्ट्रेस. स्ट्रेस मतलब क्या? स्ट्रेस, एनीथिंग इन एक्सेस इज अ स्ट्रेस. मेरे क्लिनिक के पास थोड़ा पानी रहेगा तो चलेगा, क्लिनिक के अंदर में घुसा तो स्ट्रेस. वैसे लाइफ में ना थोड़ा पानी थोड़ा गम चलेगा, लेकिन वो अंदर आ गया, मन के अंदर आ गया तो स्ट्रेस. एवरीथिंग एक्सेस इज अ स्ट्रेस. सो व्हाट वाज माय रिएक्शन 3 years बैक? जब मैंने क्लिनिक तो 10 साल पहले लिया, तब तो पानी नहीं भरता था. सो व्हाट वाज माय रिएक्शन 3 years बैक? कि फर्स्ट ऑफ ऑल आई स्कोल्ड माई सेल्फ, अरे तूने क्लिनिक क्यों लिया? लेना नहीं था, भाड़े पे ही बैठना चाहिए था. सेकेंड थिंग, मैंने वीएमसी को बहुत गालियां दी कि अरे हर साल पानी भरता है, कोई नहीं करता है. दैट वाज माय रिएक्शन. सो रिएक्शन कम फ्रॉम द इमोशन. रिएक्शन मतलब without thought, emotion come ahead. Now after 3 years I am responding to condition. Whenever there is a water logging in Virar West, I either go to hospital, take double round and call patient there, or either I go home and eat bhaji. So this is a response. Response is analysis. Response is given by thoughts. Whenever we responding the condition now, there is a thoughts ahead of emotions. For example, अगर हमारे पास आपके पास एक पेडियाट्रिक का केस आया, उसकी फीवर का केस आया, मानसून में तो फीवर का केस है. उसकी मम्मी बोली, सर आपने वो हैंड फुट माउथ डिसीज के बारे में सोचा है क्या? उसके बारे में आपने कुछ इन्वेस्टिगेशन नहीं लिखा? आपको तो पता है, मैं आप बहुत लोग, कुछ लोग बोलेंगे अरे 20 साल 30 साल पेडियाट्रिक्स कर रहा हूँ, ऐसे नहीं बैठा हूँ, तुमको अकल है क्या? अगले टाइम से मेरे पास नहीं आने का. एक तो दूसरे डॉक्टर को दिखा, लेकिन कुछ सालों के बाद आपको भी ऐसा लगेगा, उसको क्या बोलूं, ये तो गूगल डॉक्टर है, अब इसको मैं बोलूंगी तो उसको बुरा लगेगा. नहीं, मैंने इसके बारे में सोचा था, लेकिन मेरे एनालिसिस के हिसाब से इसका जरूरत नहीं है. अगली बार कुछ लगेगा या बुखार ठीक नहीं हो तो उसके बारे में हम सोचेंगे. पेरेंट इज हैप्पी. पेरेंट्स, पेशेंट्स आर नॉट इंटेलिजेंट, पेशेंट आर नॉट डॉक्टर्स. So at that time we have to react rather than react to the situation. We have to respond. हमारा स्ट्रेस सबसे बड़ा उधर ही बढ़ता है. कोई कुछ बोलता है हमको, कोई कुछ एमआर बोलता है, कभी पेशेंट बोलता है, कभी रिलेटिव बोलते हैं, कभी पॉलिटिशियंस बोलते हैं. हमारा खून है खवलता है. पहले तो अथेरोस्क्लेरोसिस रहेगा, उसमें खून खवलेगा तो you get a cardiovascular incident. So first advice is never react, always try to respond. Second, सबसे पहले मैं सोचता हूँ कि why we become a doctor. There are two ways to become a doctor. Either you dream of become a doctor or there is an accident. अपने सबके साथ एक हुआ है. हमने कभी तो स्कूल में बचपन में देखा है कि मुझे डॉक्टर बनना है, डॉक्टर बनना है. नहीं तो अपने मेडिकल में मार्क मिलने इतने एडमिशन आए हैं, या अपने पेरेंट्स डॉक्टर है, उसके लिए एक्सीडेंट से हम डॉक्टर बने हैं. सो व्हाई वी बिकम अ डॉक्टर, उसका 2 ही ऑप्शन है. सेकंड, देन व्हाट इज द पर्पस ऑफ डॉक्टर लाइफ? डॉक्टर तो बन गया, अभी क्या करने का जिंदगी में? ये किसी को भी पूछो आप अपने आज जाके हस्बैंड को पूछो, क्या रे तेरे जिंदगी का पर्पस क्या है? क्या अपनी वाइफ को पूछो, तेरे जिंदगी का पर्पस क्या है? बहुत सारे पर्पस आएंगे, लेकिन अल्टीमेट पर्पस ऑफ लाइफ इज हैप्पीनेस. अल्टीमेट पर्पस ऑफ लाइफ इज हैप्पीनेस. उसके अलावा कुछ नहीं है. क्यों नहीं है? क्योंकि हैप्पीनेस ए लिम्बिक सिस्टम के कारण एज ए ह्यूमन बीइंग हमको मिली हुई है. एनिमल के पास ये चीज बहुत कम है, या प्लांट्स वगैरह उनके पास नहीं है. हमारे पास लिम्बिक सिस्टम है. हमारे अल्टीमेट पर्पस ऑफ लाइफ इज हैप्पीनेस. अब मैं अभी आपको सिंपल सवाल पूछूंगा, इज योर लाइफ इज गुड? तो उसके 2-3 है. इफ योर लाइफ इज बेस्ट, इफ यू आर हैप्पी एंड एंजॉइंग. योर लाइफ इज बेस्ट इफ यू आर हैप्पी एंड एंजॉइंग. योर लाइफ इज डिफिकल्ट if you are analysis thing and you become happy. If you are analyzing thing, your life is difficult. And if your life is worst, if you criticize yourself, criticize others, and you become frustrated. So life is best when you are happy, life is difficult when you are unhappy, life is worst when you criticize and frustrated. So if you want to a best life, be happy and enjoy your life. So simple words, I want to explain the life. Life is a journey, it's not destination. एक प्रवास आहे, तो मजेमध्ये करायचा आहे. कुठल्या स्टेशनला उतरायचं कुणालाच माहिती नाहीये. सो प्रवासामध्ये सहकारी बनवा, मजा करा. लाइफ इज अ जर्नी, इट्स नॉट डेस्टिनेशन. सो अपना गाड़ी की तरह लगता है डॉक्टर लोगों का. डॉक्टर लोगों का अपना लाइफ इज लाइक मैग्नेट. द मैग्नेट इज अ सक्सेस. हमको सक्सेस और हैप्पीनेस ये दो चीज समझी ही नहीं है. सक्सेस क्या और हैप्पीनेस क्या है? एवरीवन वांट टू सक्सेस. The what I define success is a measure by others. और इसके पास तो और मर्सिडीज है, दो मर्सिडीज है, 50 बेड का हॉस्पिटल है, डॉक्टर तो पॉलिटिशियन के साथ उठता बैठता है. क्या सक्सेसफुल आदमी है, क्या था पहले. हैप्पीनेस इज अ परसेप्शन बाय यू. आपको अंदर से क्या लगता है? आपको लगता है सब कुछ है, लेकिन मैं अंदर से सच में खुश हूं क्या? हैप्पीनेस एंड सक्सेस गो टुगेदर. वो एक साथ भी जा सकते हैं, लेकिन गिव अ प्रायोरिटी टू हैप्पीनेस रादर देन सक्सेस. This is a key key slide of my talk. Give always important to success, happiness rather than success. So life phases of doctors. डॉक्टर के लाइफ में क्या फेजेस है? डॉक्टर के लाइफ में there are 3 phases. The first is early phase. I called it as student phase. From student to early doctor, before starting a hospital, we dream a lot. मुझे ये बनना है, मुझे वो बनना है. We have time, energy, we don't have money. Internship में किधर 13,000 स्टाइपेंड मिलता है, किधर 5,000 मिलता है. We have जबरदस्त टाइम, इसका लोकम करेंगे, उसका लोकम करेंगे, दिन रात काम करेंगे, नाइट करेंगे, बट हमारे पास टाइम, एनर्जी, हमारे पास मनी ही नहीं दिया भगवान ने. We have high ethics. जिंदगी में सब कुछ करने का, वो जो पीजी का थीसिस था ना, वैसे ही जिंदगी इतिस करने का. 2 से ज्यादा दवा नहीं लिखने का, 1 से ज्यादा दवा नहीं लिखने का. बुखार है तो एंटीबायोटिक नहीं देने का. वी हैव रैशनल साइंटिफिक लाइफ. उसके बाद हम आते हैं मिडल एज. यानी पहले हम बैठे विरार के ट्रेन में, विरार से लेके हम वसई तक हम अर्ली फेज में थे, बहुत खुश थे. लेकिन वसई में डॉक्टर की भर्ती हो गई ट्रेन में, हमारे बहुत सारे डॉक्टर आ गए. नाउ वी स्टार्टेड चेजिंग आवर ड्रीम्स. हम जब तक बोरीवली दादर पहुंचते नहीं तो हमारा फाइट चल रहे थे. सबसे पहले हम बोरीवली पहुंचते हैं, तब हमारे पास मनी आता है, एनर्जी आता है, हमारे पास टाइम नहीं होता है, क्योंकि ट्रेन में बहुत भीड़ हो गई. फिर हमको समझता है कि आज मेरे पास मनी है, एनर्जी है, आई डोंट हैव टाइम. बट हमारे पास मॉनिटरी परस्यूट रहता है. परस्यूट ऑफ हैप्पीनेस इज अ मॉनिटरी गेम्स. हम मॉनिटरी गेम्स में रहते हैं. ग्रीड इज अ मोस्ट इंपॉर्टेंट फैक्टर इन सेकंड फेज ऑफ लाइफ. आज मेरे पास 50 पेशेंट है ना, अरे 100 तक जाना है. क्यों? कि बाकी के डॉक्टर के पास 100 है. ये स्टेशन का क्या उसमें डायलॉग था अपना, जो अभी एक हॉलीवुड का मूवी आया था ना, क्या चाहिए जिंदगी, रॉकी भाई का मूवी था, क्या चाहिए दुनिया. वैसे ये स्टेशन का सबसे बड़ा डॉक्टर बनना है, ये ड्रीम्स रहता है. जैसे ग्रीड. So that time, that phase of life, I called it as a success without happiness. There is a success but without happiness. I called it as a struggling phase of life. यहाँ तक हम विरार में चढ़े थे, हमारा लाइफ वसई तक, नायगांव तक अच्छा था. उसके बाद हम बोरीवली गए, हमको समझ गया कि अभी मैं थक गया हूँ, सक्सेस हूँ, हैप्पी नहीं हूँ. फिर भी हमारा ग्रिड जाते नहीं, हम दादर तक खींचते हैं. दादर तक खींचते खींचते हम आते हैं बॉम्बे सेंट्रल नायर हॉस्पिटल के पास में. दैट इज अ लेट स्टेज ऑफ लाइफ. हम एनालिसिस करते हैं अपनी लाइफ का. वो समझता है मनी तो है, टाइम तो है, लेकिन एनर्जी नहीं. फिर हम हमारे लाइफ को एनालिसिस करते करते समझता है कि मैंने तो मेरा लाइफ वेस्ट किया, कुछ नहीं किया लाइफ में, मैंने खाली पैसा कमाया. आज मेरे पास पैसा है, वो भी कुछ काम का नहीं है. सो दिस इज कॉल्ड एज अ फेज ऑफ इटर्नल अनहैप्पीनेस. जिंदगी भर वो लोग दुखी रहते हैं. अभी आपने वसई विरार में ऐसे कोई डॉक्टर नहीं है, क्योंकि सब जितने भी डॉक्टर है वो सब हैप्पी है, बिकॉज उनको हॉबीज है. और डॉक्टर बारोत अभी डॉक्टर मंगेश प्रभुलकर अभी वारी करके आए, उनके जैसा हैप्पी क्या लाइफ जीना चाहिए. So this is until unless you don't have hobbies, now your life is eternal unhappiness in less stage. So this is the phases of life, doctor life. Moral क्या? Moral simple है. In young age we lose health for the wealth. पैसा कमाओ, health तो बाद में देखेंगे. And old age we do a reverse. We spend wealth. We do preventive coronary CT, preventive angiography. We do everything because we have money. We don't want disease. So basic is live life with minimum luggage. जिंदगी जीना है ना, घूमने के लिए जाना है ना, दुनिया घूमनी है ना, तो अपने पास लगेज कम रखो. लगेज ज्यादा रहेगा तो लगेज को ही संभालना पड़ता है. बिकॉज इफ यू कैरी मोर लगेज ना, you get less happiness and more success. So any type of luggage, it might be a luggage of ego, luggage of money, luggage of relationship, luggage of responsibilities. Live life with a minimum luggage. So main reason for doctor stress. आप बोलेंगे सर ये तो बता दिया आपने, स्ट्रेस के कारण क्या है हमारे. हम तो ढूंढने तो पाए आज क्लिनिक घर में जाने के बाद रात को सोने से पहले कि मेरे लाइफ में स्ट्रेस के क्या कारण है. बहुत कारण है. तो सबसे बड़ा कारण इज एक्सपेक्टेशन वर्सेस रियलिटी. हमको लाइफ चाहिए बहुत चंगा, बट सब हर बार नहीं होती है ना. हर बार लाइफ नहीं चंगा हो सकती है. हम चाहते हैं हमारा 100 बेड का सेटअप रहे, हम चाहते हैं हमारे पास 10 आरएमओ रहे, हम चाहते हैं कि वसई में, विरार में हमारे बड़े बंगलो रहे, फार्म हाउस रहे. हमारे एक्सपेक्टेशंस है, हमको सब लोग मान दे, सब लोग हमको पूछे, बट रियलिटी हमको स्वीकार करना है. ठीक है, अभी विरार में पानी नहीं भरना चाहिए हमारा एक्सपेक्टेशन है, लेकिन विरार में पानी भरेगा ये रियलिटी है. तो व्हाट इज द फ्रस्ट्रेशन? फ्रस्ट्रेशन इज द गैप बिटवीन एक्सपेक्टेशंस एंड रियलिटी. इफ यू डोंट वांट टू फ्रस्ट्रेट ना, एक्सपेक्टेशन कम करो या रियलिटी एक्सपेक्टेशन रखो या रियलिटी बढ़ाने की कोशिश करो. इट्स डिफिकल्ट टू इंक्रीज रियलिटी इन सिंगल डेज, बट एक्सपेक्टेशन कम करना बहुत ईजी है. सो इफ यू वांट टू हैप्पी लाइफ, एक्सपेक्टेशन थोड़ा कम करो. सेकंड इज द रिस्पॉन्सिबिलिटी एंड इमरजेंसी. व्हाई डॉक्टर हैव मोर स्ट्रेस? हम 24/7 हमको अलर्ट रहना है, 24/7 हम रिस्पॉन्सिबल है. भले हमारा हॉस्पिटल नहीं है, फिर भी हमने ओपीडी में पेशेंट देखा तो भी हम रिस्पॉन्सिबल है. सो रिस्पॉन्सिबिलिटी एंड इमरजेंसी के कारण डॉक्टर्स आर मोर प्रोन फॉर कार्डियोलॉजिकल डिसीज. थर्ड इज द डॉक्टर पेशेंट रिलेशनशिप. पहले का जमाना का ना बहुत मोहब्बत का था, 70 और 80 का. डॉक्टर पेशेंट रिलेशनशिप में मोहब्बत वाले थे, बहुत अच्छे थे. अभी सब एक आमिर खान नाम का एक आदमी आया, उसने ना सत्यमेव जयते से हमारी वाट लगा दी. हमारे रिलेशन इतने खराब किए कि आज हमारा हाथ इतना बड़ा हो गया, हम पेशेंट से दूर से देखते हैं. आज हमारे इसमें मन में इतना डर है, हमको अगर पेशेंट को फीवर भी आया तो अब हम उसका सब पूरा फीवर प्रोफाइल करते हैं. लोग बोलते हैं कि क्लिनिकल एग्जामिनेशन सब कम हो गए हैं, जो पैथोलॉजिकल एंड रेडियोलॉजिकल एग्जामिनेशन बढ़ गए. दिस इज बिकॉज डॉक्टर पेशेंट रिलेशनशिप. एवरी क्लिनिशियन इज गुड हियर, बट प्रॉब्लम इज फियर. So we have to work on doctor patient relationship. उससे भी बढ़िया बुरा कारण क्या है अपने समाज में? डॉक्टर रिलेशनशिप. आओ मारो तोड़ो, ये क्या कर रहा है, उसने मेरे बारे में क्या बोला, दूसरे का पेपर है तो पेपर फाड़ो फेंको, इधर क्यों गए, तुम लेट आए, नहीं तो तुमको बच्चा पाता था, तुम्हारा बिल ज्यादा हुआ. दीज आर द डॉक्टर रिलेशनशिप. सब जगह चलता है, कोई ना बोले, मुझे मालूम है सब जगह चलता है. वी आर विटनेस, बट ये कम करना चाहिए. कम कौन कर सकता है? जैसे पेडियाट्रिक्स, इंडियन सोसाइटी ऑफ पेडियाट्रिक्स, पालघर, सब पेडियाट्रिक्स साथ में है, यही कम कर सकता है. उसके अलावा कम. हमने साइकेट्री का आपसे सीख के मैंने साइकेट्री का क्लब बनाया, सब साइकेट्रिस्ट को इकट्ठा करके सोसाइटी निर्माण की. यही चीज हमारा डॉक्टर रिलेशनशिप अच्छा कर सकता है. सेकेंड इज गवर्नमेंट एंड डॉक्टर. पहले तो हमारे कोई दुश्मन नहीं था. पहले कुछ सालों के बाद पेशेंट हमको दुश्मन समझने लगे, कुछ सालों के बाद सोसाइटी हमको दुश्मन समझने लगी. अब गवर्नमेंट तो पहले से ही दुश्मन है. द लॉज एंड रेगुलेशंस, उसके कारण डॉक्टर्स आर मोर फ्रस्ट्रेटेड. मीडिया, सोशल मीडिया, गवर्नमेंट, पीसीपी एनडीटी एक्ट, ये एक्ट, सब एक्ट के अंदर में डॉक्टर्स का बहुत प्रॉब्लम हो चुका है. दिस इज वन ऑफ द स्ट्रेस फॉर डॉक्टर्स. द पर्सनल लाइफ ऑफ डॉक्टर जब लोग मैरिज से रिटायर होते हैं तब डॉक्टर लोगों का मैरिज होता है. हमारे बच्चे जब स्कूल में जाते हैं तो बाकी लोगों के बच्चे मेडिकल स्कूल में जाते हैं. सो दिस इज अ डॉक्टर्स लाइफ, रियल लाइफ. और फ्रस्ट्रेशन के लिए डॉक्टर के पास पहले से ही भगवान ने 2 गलत जादू दी है. एक इधर भी टपरी पे लेते हैं और एक रात को लेते हैं. सो दिस इज अ डॉक्टर्स पर्सनल लाइफ. सो पर्सनल लाइफ इज ऑलवेज स्ट्रेसफुल. सेकंड थिंग की एक्सेप्ट द अनएक्सपेक्टेड थिंग्स, बी रेडी. हमको नहीं जमता है, हमको किसी को दिल आ गया, नहीं ये मेरी सिस्टर है, ये मेरे हॉस्पिटल में रहेगी, ये मेरा पेशेंट है, ये मेरा आरएमओ है, ये मुझे कभी छोड़ के नहीं जाएगा. ये स्ट्रेस रहता ही है. मेरा पेशेंट दूसरे के पास गया, मेरी स्टाफ छोड़ के गई, मेरा घर वाला छोड़ के गया, मुझे रेफर करता था पहले, वो जीपी मुझे छोड़ के गया. एक्सेप्ट द अनएक्सपेक्टेड होने वाला है. लाइफ की डॉक्टर के लाइफ में स्ट्रेस देने वाला है. बी रेडी. अभी आपने बताया कि व्हाट आर द रीजन बिहाइंड द स्ट्रेस, तो व्हाट आर द सॉल्यूशंस? सॉल्यूशंस क्या है? सिंपल सॉल्यूशन बताऊंगा और ये टॉपिक क्लोज कर दूंगा. फर्स्ट इज सेल्फ लव एंड एक्सेप्टेंस. डॉक्टर सचिन लांडगे मेरा फ्रेंड है, एनेस्थेसियोलॉजिस्ट, मेरा सोलापुर का गवर्नमेंट कॉलेज का सीनियर है। उसने लिखा था आर्टिकल कि डॉक्टर नहीं बनना चाहिए, डॉक्टर बन के क्या है। इतने लोगों के फॉरवर्ड्स आए, वो वायरल हो गया, तो मुझे इतना बुरा लगा, ऐसा लगा कि अरे डॉक्टर नहीं बनना चाहिए, लोगों को कितना अच्छा लग रहा है। इफ यू डोंट लव योर सेल्फ, आपको प्यार कौन करने वाला है? यू स्टार्ट लिविंग योर सेल्फ एज अ डॉक्टर, यू लव योर सेल्फ। सबको बोलने का कि मैं डॉक्टर में खुश हूं, मैं अगले जन्म में 7 जन्म में भी डॉक्टर बनूंगा। बिकॉज इफ यू नॉट लव योर सेल्फ, यू नॉट लव योर प्रोफेशन, नो बडी लव यू। तो सेल्फ एक्सेप्टेंस इज थिंग। आज से खुद को ना ऐसे करने का, सुबह उठने के बाद मैं डॉक्टर बनाना बहुत अच्छा हो गया, अगले 7 जन्म डॉक्टर ही बनना है। इफ यू हेट, देन बोल दो ये जन्म में तो बनूंगा, अगले 6 जन्म में नहीं, 7 जन्म में नहीं बनूंगा। So love your profession, love, self-love is very important. Change the attitude. If you change your attitude now, you reach altitude. झुकेगा नहीं साला एटीट्यूड, चाहे कितना भी दुनिया का स्ट्रेस रहे, झुकेगा नहीं साला। बिकॉज दिस इज द थीम। आज बॉलीवुड पीछे पड़ गया है, साउथ इंडियन मूवी चल रहे, क्यों? उनका एटीट्यूड है झुकेगा नहीं साला। सो अपना एटीट्यूड यही रखना चाहिए कि पुष्पा पुष्पराज झुकेगा नहीं साला। सो व्हाट इज द सॉल्यूशन फॉर द प्रैक्टिस? प्रैक्टिस में क्या करना चाहिए? आई ऑलवेज बिलीव इन अ ग्रुप प्रैक्टिस, बिकॉज फॉर डॉक्टर डोंट हैव इन देयर लाइफ ना टाइम। 12.5 साल का पढ़ाई करो, उसके बाद प्रैक्टिस सेटल करने के लिए 12 साल करो, उसके बाद प्रैक्टिस बचाने के लिए और 12 साल लड़ो। टाइम किधर है? तो टाइम देगा कौन? 1 और 1 2, 2 और 2 4, वही तुमको टाइम दे सकता है, उससे बड़ा फिलोसफी नहीं है। सो वी वांट टू सक्सेसफुल प्रैक्टिस। आरआरआर मूवी देखो, आरआरआर मूवी में अकेला लड़ता है, लेकिन दोनों साथ में आते ना तो दुश्मन का खात्मा कर देते हैं। सो गोल्ड प्रैक्टिस है ना। अभी बहुत सारे बोलते हैं कि ये सब डिफिकल्ट है। मैं सिंपल बात बताता हूं, ओल्ड प्रैक्टिशनर आर गोल्ड बट न्यू वन आर आल्सो डायमंड। आप ओल्ड सब लोग गोल्ड हो, पर न्यू वन डायमंड है। लेकिन डायमंड को रखने के लिए गोल्ड ही लगता है। हीरा कभी अंगूठी में ही लगाओगे ना, सोने की अंगूठी में, तो हीरे को पास में लो। सो दिस इज अ गुड प्रैक्टिस। आई स्टार्टेड हॉस्पिटल। मैंने पहले सोचता कि मैं 5 बेड का 10 बेड का साइकेट्रिक हॉस्पिटल डालू, बट मैंने सोचा कि मैं अकेला 10 बेड का डालने से अच्छा मैं 4 साइकेट्रिस्ट लोग के 40 बेड का डालूंगा। सो मुझे भी टाइम मिलेगा, उनको भी टाइम मिलेगा, हमारा काम इजी हो जाएगा, ओपिनियंस भी हो जाएगी। सो दिस इज अ गुड प्रैक्टिस। अपना कुछ साल होने के बाद अपना एक असिस्टेंट, 1-2 असिस्टेंट अपने साथ में लेना चाहिए, इधर राउंड्स के लिए, ओपीडी के लिए। उससे हमारा क्वालिटी लेवल बढ़ता है। टर्न रिजेक्शन इनटू अपॉर्चुनिटी। सबको लगता है कि, मुझे भी लगता है, सुरेश पाटिल को सबने प्यार करना चाहिए। अरे क्यों प्यार करना चाहिए? तुझे भी तो रिजेक्शन मिल सकता है, सबको मिलता है लाइफ में रिजेक्शन। कोई इधर रिजेक्शन प्रूफ नहीं है, डिप्रेशन प्रूफ, रिजेक्शन प्रूफ कोई नहीं है। अपने को कभी कभी रिजेक्शन आएगा। कोई पेशेंट बोलेगा आप अच्छे डॉक्टर नहीं हो, घर वाले बोलेंगे तू अच्छी बहू नहीं है, घर वाले बोलेंगे तू अच्छी माँ नहीं है। तो ये सब होने वाला है, ठीक है। सो एक्सेप्ट द रिजेक्शन बिकॉज इज अ सिंबॉलिक रिजेक्शन। कोई आपको दिल से बुरा नहीं चाहता है, आपके कोई गुण रहते हैं, आपके कोई कला रहती है, उनको अच्छी नहीं लगती है। सो एक्सेप्ट द रिजेक्शन एंड टर्न इनटू अपॉर्चुनिटी। कोविड का मार्केट गिरा, शेयर मार्केट, तब जो बहुत होशियार डॉक्टर थे मेरे फ्रेंड, उन्होंने वो टाइम इतना पैसा डाला, अभी वो 50% ओपीडी में भी खुश है। सो दैट वाज अ कैलेमिटी, डिजास्टर। और डिजास्टर में भी जब तुम्हारा प्रॉब्लम होता है तब अपॉर्चुनिटी ढूंढनी आना चाहिए। सो ऑलवेज वेट फॉर अपॉर्चुनिटीज। अल्ट्रुस्टिक कोपिंग, द बेस्ट कोपिंग मैकेनिज्म वर्ल्ड इज अल्ट्रुइज्म। अल्ट्रुइज्म मतलब माफ कर देना। सो ऑलवेज गिव मोर एंड टेक लेस। जिंदगी में बहुत कुछ दो, लो कम। बट हम क्या करते हैं? वी गेट एंड वी फॉरगेट। अपन लेते हैं, भूल जाते हैं, बाद में देखेंगे एक बार ले लिया। कुछ भी रहे, वो प्यार रहे, पैसा रहे, घर लिए, या कुछ भी रहे, हम लेते हैं और भूल जाते हैं। रादर देन दिस, गिव एंड फॉरगिव। प्यार दो, मोहब्बत दो, सेवा दो, लोगों का भला करो, भूल जाओ। अल्ट्रुइज्म इज द बेस्ट। तुमको हैप्पी रहना तो अल्ट्रुस्टिक रहो। माइंड योर टंग एंड माइंड। दुनिया में सबसे ज्यादा क्लैशेस होते हैं ना, वो हाथ पैर से नहीं होते। तो मैक्सिमम क्लैशेस ऑकर बिकॉज ऑफ द टंग, और टंग के पीछे माइंड रहता है। सो माइंड योर टंग एंड माइंड योर माइंड। 4 letters we have to change. First, always replace I with the we. If you replace I with the we, illness become wellness. अरे तुम पेशेंट नहीं हो, हम साथ में है, तुम अकेला का बीमारी भगा नहीं सकते, हम सबको बीमारियां भगानी है, फिर वो शरीर की रही, मन की रही, समाज की रही. ऑलवेज आई रिप्लेस विद द वी. थर्ड लेटर है जिसको हमको भगाना है, वो ईगो. ये अगर तुम्हारे जिंदगी से गया ना, तुम्हारा जिंदगी बहुत खुश हो सकता है. तुमको भगवान भी दुखी नहीं कर सकता अगर तुम्हारे पास से ईगो गया. और फोर्थ वर्ड इज वी वांट इन लाइफ इज लव. द सबसे बेस्ट लेटर इज लव. नाउ द टू एनर्जीज आई एम हियर गिविंग टू एनर्जीज. एनर्जीज तो बहुत है, लेकिन कुछ एनर्जी जो मुझे अच्छी लगती है उसमें से दो एनर्जी है. फर्स्ट इज अ पेशन एंड सेकंड इज अ साइलेंस. आप बोलेंगे ये क्या एनर्जी है क्या? लाइफ में कुछ नहीं करना ये बहुत बड़ी एनर्जी है. डॉक्टर हु इज अ पेशेंस फॉर लॉन्गर ड्यूरेशन हैव अ मैक्सिमम नंबर ऑफ पेशेंस. तुमको पेशेंट चाहिए ना तो पेशेंस रखो, बिकॉज पेशेंस मेक यू मेंटली स्ट्रांग. इफ यू वांट टू मेंटली स्ट्रांग यू नीड अ पेशेंस. सेकंड इज साइलेंस. If you don't want violence in your hospital or clinic, now be a silence. Be a silent listener. Be a silent reactive person. There never be a violence in your hospital or clinic. बड़े बड़े डॉक्टर उनके इधर कभी मैंने देखा नहीं है, अपने वसई विरार में कभी उनके हॉस्पिटल में कोई राड़ा हुआ है. So silence is a key because it's a strong emotional. It make you emotionally strong. If you're silent, that make you emotionally strong. So how to search happiness? आप बोलेंगे कि तूने एक ही बोला इतने टाइम तक कि हैप्पी रहना है. हैप्पीनेस कहाँ ढूंढना है? हैप्पीनेस आईने में ढूंढना है. जोशी मैडम बोली है क्या बोल रहे हैं, हैप्पीनेस आईने में ढूंढना है. यस मैम, हैप्पीनेस अपने में ही है. हम खुद को खाली आईने में ही देखते हैं. अपना मन एक आईना है लेकिन हम उसमें झांकते नहीं है. तो आईने में देखना है और खुद को बोलना है कि हैप्पीनेस कल से मैं तुझ में ढूंढूंगी. सो हाउ टू फाइंड आउट हैप्पीनेस? First is motivate yourself, love yourself. मैंने पहले बोला है, love yourself, motivate yourself. Do all the things with the passion and joy. जो भी करो ना मस्ती और पैशन से करो. दंगा करना है घर में मस्ती पैशन, खेलना है मस्ती पैशन, प्रैक्टिस करना है मस्ती पैशन, वेबिनार अरेंज करना है, वेबिनार अटेंड करना है मस्ती पैशन. So motivate yourself with the love and passion. Share your happiness. हम यहाँ से दूसरी जगह क्या दे सकते हैं तो हैप्पीनेस है, उसका खर्चा नहीं आता है. ये जो अपना ब्लूटूथ वगैरह है ना, ब्लूटूथ और उससे 10 गुना फास्टर है वो. आप खाली स्माइल दो, 10 लोग हंसेंगे, उससे फास्टर कोई डिवाइस नहीं है. तो शेयर योर हैप्पीनेस. अपने पास रखेंगे. हमारे पास अगर कचरा रखेंगे तो घर में बदबू आएगी ना. हम कचरा बाहर डालेंगे, कहाँ से बदबू आएगी? अपने गम जैसे हम बांटेंगे ना, वैसे हमारे पास की घर की मिठाई भी बांटनी चाहिए. हमारे पास हैप्पीनेस का मिठाई है, हैप्पीनेस का मिठाई सब में बांटना चाहिए. तो शेयर योर हैप्पीनेस. एंड माय डियर फ्रेंड्स, ऑलवेज कीप इन द माइंड लाइफ हैज एक्सपायरी डेट. मेडिसिन को ही खाली एक्सपायरी डेट नहीं है, लाइफ को भी एक्सपायरी डेट है. डाई यंग एज लेट एज पॉसिबल. उधर राजीव शर्मा सर को मैडम ने, गोकर्ण मैडम ने एक सवाल पूछा था, अरे ओल्ड एज का डेफिनेशन क्या है? मैडम, मैंने जवानों को भी बुढ़ापे में देखा है, मैंने जवानों को भी बुढ़ापे में देखा है और बुढ़ापे में जवानी का जोश देखा है. हम जब तक मानते नहीं तब तक हमको खुदा भी बूढ़ा नहीं बनाता है. तो डाई यंग एज पॉसिबल, बी अ यंग इन लाइफ टाइम. जो लाइफस्टाइल मैनेजमेंट अभी मीना मैडम बोलेंगी, राजीव शर्मा सर ने जो बोला है कार्डियक गाइडेंस, वो सब लेके हमको लाइफ में बूढ़ा बनना नहीं है. और आखिर का मेरा डायलॉग है, लाइफ इज अ जर्नी फ्रॉम ह्यूमन बीइंग टू बीइंग अ ह्यूमन. भगवान तो होमो सेपियन से सोपियन से हम आगे जाके ह्यूमन बीइंग बन गए हैं, लेकिन जर्नी इज नॉट बीइंग ह्यूमन बीइंग. लाइफ इज अ जर्नी फ्रॉम ह्यूमन बीइंग टू बीइंग ह्यूमन. क्यों? क्योंकि दिल तो बच्चा ही जी, और मुझे बुलाया है बच्चों के डॉक्टर ने, उसके लिए दिल तो बच्चा ही ध्यान में रखो. दिल पागल, दिल दीवाना, आपके पास दिल बच्चे वाले ही है, सबसे हंसी खुशी वाले दिल. थैंक यू. फ्रॉम द साइकेट्रिस्ट फ्रॉम द बॉलीवुड, डॉक्टर अक्षय कुमार. और लास्ट का एक शायरी, शहर में बिखरी हुई है, शहर में बिखरी हुई है जख्म दिल की खूबियां. शहर में बिखरी हुई है जख्म दिल की खुशबियां. ऐसा लगता है दीवानों का मौसम आने वाला है. अभी दीवानों का मौसम आने वाला है. सब दिल जवान होने वाले हैं. डॉक्टर राजीव शर्मा ने हजारों दिल बचाए हैं. आज प्रिवेंटिव कार्डियोलॉजी में उन्होंने और कैसे बचना है बताया है, और वीना मैडम बताए कि हमको लाइफस्टाइल कैसी चाहिए है. थैंक यू एवरीवन.
थैंक यू सुरेश.
इसमें मीटिंग करेंगे.
वेरी नाइस. सब जवान दिल सुन रहे हैं आपका वेबिनार.
Thank you, sir. Thank you for that lovely talk about how to keep ourselves stress-free. Now moving on to our last talk on a very
It was a very nice ending. Thank you so much.
So coming to our last talk on a very important topic about lifestyle modification, I'm happy to welcome Dr. Beena Apothekar. Dr. Beena has completed her anesthesiology training from JJ Hospital, and she's practiced anesthesiology for 15 years. After that, she's been actively involved in fitness programs since 2003. And she's also obtained a diploma in nutrition and health education. Now she's practicing as an obesity, health and wellness consultant since 2011. And she's experienced in lifestyle management in chronic conditions like diabetes, PCOS. And she's also administrator of the Global Hospital in Nalasopara. So Dr. Beena is going to be our lifestyle coach today. Without further delay, I invite Dr. Beena to start her talk. Welcome, madam.
Thank you, Dr. Manveen, for a very nice introduction. I'm humbled. I think many of the things that I'm actually going to be talking today have been sort of covered already. But I just wanted to know how many doctors do we have? And I mean, we have, what kind of an audience do we have today? Because I'll have to simplify the whole concept of lifestyle.
50% are doctors.
Okay, fine.
Pediatricians basically.
My slides are basically a little medical, so I'll just show them for the doctors, but I'll have to explain for other people. Okay. Is my screen visible?
Yes.
Yes, ma'am.
Okay. So today we're going to discuss lifestyle management for heart health. And I specifically wanted to know from Anjali last time whether we are going to talk about preventive heart health. And because in terms of modalities in nutrition and exercise management for heart, there's a huge array of things that are possible to be done. So I'm today focusing more on preventing heart conditions. So I just want to, there are a lot of things in terms of diet and diabetes control and obesity management, which is already out there everywhere, in the media. Doctors keep spreading the information and they know. So I thought I'll just focus on a few key things because I was told I had only 20 minutes. So rather than, I will go into the details later on in a short manner about all the other aspects, because that's a huge topic by itself if I have to sit and discuss about diabetes management or obesity management, stuff like that. But because it was heart health, I thought I'd focus on just a few key things which may not be very apparent to a lot of people and people may not be aware about it. So let's start with the idea of what a coronary vessel is. It's the blood vessel which supplies the heart. And normally we talk about a heart attack is when there is a blockage to the blood supply of a particular area of the heart. Okay. So one of the key things about a blood vessel is its endothelium, which is the inner lining of the blood vessel, which you can see over here, where there's a cross section of it, and you have something called the endothelium. So the endothelium is like the life jacket and the guardian of our blood vessels. So any kind of damage to the endothelium is what initiates a process of atherosclerosis, inflammation, having more blockages, and that finally disrupts the blood flow to the subsequent tissue, and that's how we get a heart attack. So it's important to understand the endothelial concept of managing heart attacks or preventing heart attacks. So if you look at the endothelium, there is a fine line. You can see the small cells which are there. So in between, these are the, like this is the endothelial cell. It's just a one layered lining of cells, okay? And the blood is flowing through this area. At the same time, there are these layers of a blood vessel. You have the muscle of the blood vessel. Now, based on the need of the heart, whether it needs more blood supply or less blood supply, this muscle will contract and increase or decrease the diameter of this blood vessel, and then it decides how much blood has to go. Now, what happens in something like atherosclerosis, or the process where this endothelial diameter becomes less and less and less, where it is replaced by fatty plaques and a lot of deposits, some part of blood cells which come here. So as this starts getting choked up, the access to blood to the tissues is hampered, and less blood passes out from the blood vessel. Okay, so let's understand what are the factors which will increase our chances of developing a cardiovascular event. Okay, so a cardiovascular risk is as we are nowadays, we see that we are living longer. Like you have parents, grandparents who come to know anybody almost is. In fact, the average global life expectancy today is supposed to be around 76 years, 76.2. So unlike a decade ago where we had a lower life expectancy, we are living longer, but we're not living healthier. And if you look at coronary artery disease, that's one of the major killers in today's times. And as Dr. Suresh also discussed, stress, I think, is a very big prominent factor in causing cardiovascular events. And unfortunately, it is extremely difficult for us to get stress really out of our lives and to focus on not those kind of things. So I think if we could remove stress, we would definitely reduce our chances of CV risk to a great extent. In addition to that, unfortunately, our lifestyle today has become such that we are completely facing so many other diseases. We have diabetes, we have obesity, we have unhealthy habits to take care of stress like smoking, hypertension. If you look at the obesity epidemic, it has really ballooned today. We have more and more people. In fact, almost I see a lot of young people, and I check fasting insulin on most of them, and I end up seeing high fasting insulin. So insulin resistance, even if somebody does not have diabetes, pre-diabetic is there in a huge amount in our population, and especially in us South Asians. And insulin resistance is the root cause of so many problems that we are seeing today in chronic metabolic diseases. Then again, as Dr. Rajiv discussed, we have women, especially women, do like not pay attention to their health. And by the time they are menopausal, then all the problem starts because the protective estrogen effect is gone. And women are as much or even more at risk for cardiovascular events by the time they have attained menopause, or if they had early menopause. And unfortunately, in India, it still happens that women do neglect their health to a great extent. And it is too late by the time they actually want to do a major lifestyle management change, or really, they don't take their own health seriously enough. They're just catering to everybody's health in the family. And that's a huge population that is lost out to us, because whenever I see women who are depressed, who are stressed, who come to me, and I really want to insist that they have to take care of themselves first. They have to learn to be happy first in order to keep the family happy. So if the woman is not happy, in fact, the entire family system completely collapses. And yeah, as as Dr. Rajiv discussed, many a times nowadays, I see a lot of young patients, and I was working for 1 year at a center of functional medicine. And there we saw a lot of patients with erectile dysfunction. It is very common right now, even in young boys, like in 27, 28-year-olds. And as doctors, I think we have always been a little reluctant to ask about history of ED or any kind of sexual problems. In fact, we hardly ask sexual history in any of our patients. So in my practice, my consultation goes on for a very long time, almost an hour, and they kind of end up, it's more like a psychological counseling. And I have noticed that this is quite common. And in fact, it's supposed to be like the first heart attack. So if you know that there is a history of erectile dysfunction in the man, definitely you're going to, I think, I always try and investigate further and figure out if there is chance of developing a cardiac problem. As we mentioned earlier, CVD risk is actually really high in South Asians. It is 3 times more than Westerners, especially because we have this thrifty gene syndrome, where we had a lot of famines, and then we did not have food. And then now we kept on alternating between having food and not having food. So the Indian phenotype is one where we are like the thin fat Indians. We have pot bellies. That is because mostly we have insulin resistance. We have a lot of abdominal obesity. We have thin arms and thin legs. And we are at increasing risk for developing all kinds of diseases, like especially diabetes and cardiovascular disorders, and even cancer. In fact, I will like to talk a little about inflammation later, and I'll discuss as we proceed from here. As I said, nitric oxide, as I discussed, the blood vessel which was there in the side, in the endothelium. Now, one of the most important product of the endothelial lining or the cell is something called nitric oxide. So, in fact, there was a Nobel Prize awarded for discovery of nitric oxide in 1998. So, what does nitric oxide do? It's a gas, it's a molecule. It's not the same as a nitrous oxide, which is there in an anesthesia machine. So nitric oxide is a gas which is released by the endothelial lining, and it is a very important component of keeping our blood vessels in an open form. Most of the blood vessels have a certain diameter. So if you want more blood supply, it has to be a little larger diameter and it has to be dilated, something called vasodilatation. So nitric oxide actually prevents stickiness of substances as are flowing through the diameter of that blood vessel. It promotes something called vasodilatation, meaning it increases or enlarges the diameter of the blood vessel. So more blood supply goes to the heart, and the heart is well perfused with the nutrients and oxygen that needs to keep going. Okay. In fact, if you look at our heart, it is the only muscle which doesn't stop till we are dead. So in fact, cardiac muscle has a maximum number of something called mitochondria. Okay, these are like the powerhouse of our cells, and they have almost 30% more mitochondria than any of the other cells. So they have to constantly regenerate energy. In fact, like the mitochondria can't say, oh, I'm too tired today, I'm taking a break, boss, let me lie down for some time, let the other myocytes do the job. It doesn't happen. So if you look at the pressure that a cardiac muscle goes through of constantly producing ATP to contract, it's a whole, at the energy level, at the molecular level, it's a big process. There's so much happening there. So constantly pumping the, pumping muscle, producing so much, needing so much energy to cause the action of pumping a heart muscle so that more blood can flow all over your body. That's a huge amount of energy requirement. So mitochondrial, as we age, something called mitochondrial decline happens. Okay, I'll go into it in a little detail later. The other thing that nitric oxide also does is it prevents arterial thickening. So as I said, it causes vasodilatation. So when you have a dilated artery, the internal stuff passes through very nicely through the blood vessel. If you consider laws of physics, like you have the Starling, you have the laws where the head of the flow goes ahead. But if it is a slower process, if it is a constricted artery, things will be circulating and sort of going round and round, and it increases more attachment of different substances around the arterial wall and more arterial thickenings. Also, there is something called foam cells which are formed around in a atherosclerotic plaque. So these are like big white blood cells or leukocytes which come there to actually clear out unnecessary debris or kachra that is accumulating in the blood vessel. So these foam cells kind of become bigger and bigger, and they attract more substances called pro-inflammatory cytokines. And that's how a plaque forms. And more fat comes and sits there, and then the whole artery gets blocked. So nitric oxide has an ability to actually destroy some foam cells. So what happens is, how is nitric oxide made in the body? So there is something called L-arginine and citrulline. Okay. So these are, arginine is an amino acid, and this arginine is then converted by a series of reactions using an enzyme called endothelial nitric oxide synthase, okay, ENOS. So this enzyme then converts arginine into nitric oxide. So when we grow older, our ability to make nitric oxide goes down with age and almost drops down to 50% by the time we are in our 55 or 60-year age. Okay. So what happens is, automatically, if you look at the whole dynamics of this, we need that nitric oxide to keep our vessels dilated, to pump more blood, but we are growing older and the demand is more. We are more stressed out. We are doing too many things at a certain time from say 40 to 60 age group. The demand is more and our blood vessels cannot keep up. So what happens is, the nitric oxide levels start dropping. So the diameter of the blood vessel, which we need to keep it patent for more blood flow, starts going smaller. And that is how it will attract all kinds of pro-inflammatory cytokines and cause a plaque. The other reason is, by the time we are around middle age, we have so many other factors which cause stress. We'd start developing diabetes. If you're a postmenopausal woman, there's estrogen deficiency, which again causes a reduction in the caliber of these blood vessels. There is insulin resistance, which happens over a period of time. And if you look at everybody around us, hardly anybody, the Indian BMI standard is 23. I rarely come across anybody with a BMI of 23 and a waist circumference of less than the required one for male and female, less than 90 centimeters in a man and 85 centimeters in a woman. So if you look at it, everybody is kind of insulin resistant. And insulin resistance at a very molecular level is actually has a lot of connotations, right from causing changes in the cellular dynamics at the endothelial level, increasing inflammation and things like that. So that's a huge topic. I don't have much time. So let me just talk about what is relevant to us. How do we increase our nitric oxide levels if we really want to increase our cardiac capacity? So we have a few things which are available to us. You have beetroot. Okay, if you have beet greens and a beetroot juice, just 225 ml of a beet juice gives you enough amount of nitric oxide which can be generated. So not just for like I'm basically into a lot of exercise routines. It's not just for my cardiac health. I want a good amount of nitric oxide when I'm working out. I want aerobic capacity. I want to boost in my performance. Or even if I'm doing resistance training, I want my muscles to be infused with enough nutrients. So I would prefer a nitric oxide push. Okay. So you have beetroot juice, which is good. Only thing is, there are still a little doubts about whether it can raise some amount of blood sugar, because 100 ml of beetroot juice will give you has 10 grams of carbs, which is around 7 grams of sugar. So definitely, like if you are a diabetic, there are ways. I would still recommend a beetroot juice, but find other ways of not raising the sugar. So you can add fiber, you can have the entire fruit, you can add some other fruit with it. And at the same time, then you can decide to do some kind of exercise. So I think many a times in medicine, what happens is we just take one particular thing and label it as good and we keep overdoing it, or we label something as bad and not do it. So as a nutritionist, I always have to strike a balance between what is really right for a person. It has to be individualized. So every nutrition plan has to be very individualized, because I have to gauge between whether a person is sedentary, wanting to do exercise, how bad are his arteries, what can be done for him, how good he needs to feel, because initially even he has to feel good about doing an exercise program. So I have to start with that motivation in the very beginning. So I have to juggle this all the time and figure out what needs to be given. The other thing that we have is garlic. Garlic also causes a rise in nitric oxide levels, but the action of garlic is a little short-lived. But luckily for us, I think Indians, we can't do without a garlic. We put it in everything. So please load on that garlic, like lots of garlic. In fact, you can just eat garlic or do whatever. Like, it's really fantastic for health. The other important aspect is especially leafy greens. Like there is an emphasis of eating a lot of leafy greens for all conditions, actually, because they're going to be rich in folic acid. They're going to be rich in magnesium, a lot of minerals there. You're going to look at a lot of things in all kinds of leafy greens. Unfortunately, I think we're not really having our daily quota. In fact, earlier we had something called the RDA, the recommended daily allowances. So the RDA was actually based on something called deficiency basis. Like you had a disease and you feel if you give this, that RDA will only not cause the disease. But today we are looking at RDAs which are about health span, not lifespan. We're not talking about being just surviving in today's times. We have to look at something called the longevity patterns. Okay, there are so many things called longevity genes. Epigenetic changes are happening in our body all the time. So we are looking at something called a health span. So we need a bigger amount of the right kind of nutrients to have healthier systems, to have healthier biochemical, molecular, and mechanical systems at a very basic cellular level, at the mitochondrial level. So especially things like spinach, arugula, kale, bok choy, they can raise your nitric oxide levels. Only problem is when you cook, any method of cooking is going to destroy it. So you have to be very careful how you're going to have it. So our food and the way we ingest things has changed a lot. We only figure out, good, tasty stuff and all that, but we'll have to find based on different regions and where you come from, we have to figure out a way to make these in a more bioavailable manner. Okay. Luckily, I'm very fond of watermelon, and I was so happy when I found that watermelon contains citrulline. So citrulline is another product which becomes arginine, and then it becomes nitric oxide. So yes, please go have your fresh watermelon juices. It's really a good thing to do. The other substances which are very rich in arginine, and again, nuts, seeds, especially the omega-3 based nuts and seeds. Okay. There's lots of things. Okay. Dark chocolate, citrus fruits, red wine, especially alcohol too, maybe in moderation, 2 glasses for men and 1 glass for women. Because of all their phytochemicals and isoflavonoids are actually, they kind of work synergistically with the actions of the other substances which raise the nitric oxide levels. So at a cellular level, you need something which is going to boost vasodilatation. You need something which is going to remove the ROS, the reactive oxygen species. Whenever there is metabolism in any particular cell, what you have is the end products of that metabolism, all the, like the waste products are what are ROS and RNS, the reactive oxygen species and the reactive nitrogen species. So now what happens is you want all those things to be cleared. So there are different enzyme systems in our body. We have an entire system. In fact, I'll talk, like when you talk about antioxidants, we had this whole wave where we used to take a lot of antioxidants, but today, if you look at the field of epigenetics, it has done a lot of progress in the last 20 years. Today, you can give foods which actually potentiate the action of antioxidant enzymes, which will create antioxidants in your body. Okay, there's an entire system. You can eat foods which will increase the glutathione synthase activity. You don't have to take an antioxidant in terms of a direct antioxidant. You can have foods in addition which will potentiate the enzyme systems which are required for antioxidant enzyme stimulation. So there are a lot of things like I'll come across, we'll talk about that as we're discussing inflammation. So like you have, as we all know, inflammation is a root cause for most of our chronic diseases, from coronary artery disease to diabetes to cancer, or even many of our autoimmune diseases. We are seeing a lot of Hashimoto's thyroiditis or rheumatoid arthritis these days. Reason for that is being inflammation. Okay. Now, for those who are not doctors, inflammation is something like, if you ever get hurt, okay, and you hit your hand against some hard surface, you will find that it becomes, red. Then after some time, it will be swollen, and it will be like, then slowly, it's difficult to use that hand, and loss of function happens. So the same thing, this is at a macroscopic level. It is something you can see. But something like that is happening in our cells at a very microscopic level. So it is happening in our heart cells, it's happening in a liver cell, it's happening in our joint cells, it's happening everywhere. So this is something you see from the outside, but at a cellular level, these things are happening. Now, how, if you look at it externally, when you hit your hand against a surface, you will see it because you hit it against it. So what are the triggers which are causing inflammation internally? What is that hard surface that is actually, sort of squeezing the cells to become inflammatory? So if you look at our lifestyle today, right from the air, the water, the food we eat, there are a lot of pollutants, okay? There's so much, look at the number of cars we have. I think every family has now 4 cars. No, it's like that. So unfortunately, what are we doing? We are releasing a lot of carbon monoxide. We are releasing a lot of exhausted, a lot of bad gases into the atmosphere. We are inhaling them. Okay, even if you have all kinds of, like high-end cars and you feel it safe, but it is still, there are other cars you're inhaling. I mean, air is free for everyone. Also, the poisons are free for everyone, right? So what happens is, that's one issue. The other problem is, if you look at our water, you need better governance to have sanitation methods. Like I found Dr. Suresh Patil's slide where there was water collected outside this. Believe me, we are living, I think 75 years after independence, these things should not have happened. There should be a better system where that stress should not be there. In Vasai, still we are struggling. I mean, imagine a lady who gets up at 4 o'clock in the morning, aadhe ghante ke liye pani aata hai, pani bharne ka. And look at the stress that she has throughout the day. And she starts the day with so much stress. Most of the people living here, sometimes you have water only for 10 minutes, and then they go back to sleep, and then they start their day with so much stress. So that stress also causes inflammation. Okay. The other thing is all the pollutants. If you look at the food, all the foods that you see, like there's a huge debate on what diet we should really have. Whether it should be the paleo diet or the vegan or the vegetarian, or all kinds of fancy diets are coming up. Now, what happens is we have to understand what is relevant for our times. Like if you look at the paleo diet in those times, it is definitely significant because you have grass-fed. What kind of chicken you are getting today? What are the animals eating? They are eating corn. They are eating terrible stuff. Then they are being pumped with antibiotics. Okay, so that they just have this factory outlet where you produce animals which can be fed to human beings. So look at the cows. They're constantly pumped with, like you can't expect a cow to produce so much milk. And everything is, what are you drinking finally? So if you look at that, look at our plants, like the need for commercialization and to be successful, whether it's a farmer or whatever, to produce more and more. And the marketability of it has started another trend where you're using lots of pesticides and fungicides and herbicides. There's a herbicide called glyphosate, which is used in most of the plants. So whether you're eating, all the vegetables, almost 70% of it is being used everywhere. So you do not know what you're really consuming. because we think that maybe plants are good for us. That spinach I bring, which I think will increase my nitric oxide, ideally should be eaten without like really cooking it, but then it is sprayed with God knows what, right? So I am also taking something else with me in addition to the grains or the arginine coming from it. So we have to be very conscious and aware of the industry and all that we are being exposed to. Like if you look at oil, many of us, most people are using refined oils. Now, if you look at refined oil, it goes through at least 17 chemical reactions. Okay. It's literally really bad. Vegetable oil has a lot of polyunsaturated omega-6 fatty acids, and it goes through multiple chemical reactions where it is, they remove the color, then it is deodorized, and it is again some other chemicals. So the whole process. So by the time it comes out, it has so many chemicals in it. It's not safe for you. It is 100% carcinogenic. And the amount of consumption of these oils has increased multiple fold. So we have to think twice as to how we are going to eat our food, whether it is right or not. In fact, whenever the need for something called anti-inflammatory foods is increasing. So where is the inflammation coming from? It is coming from all these chemicals that are being used. Today, we use a lot of packet products. Anything which is in a box is not nutrition. Even a Subway sandwich or burger, whatever you're having. So anything that comes in a box is either deep fried in a vegetable oil. It's also, they use a lot of sauces which have preservatives, emulsifiers. Have you ever looked at the labels? There are, there are n number of chemicals there. Do you even know what those chemicals are? There are coloring agents and all kinds of things. So we are just trying to please people visually with the food, but not really in any other organic way. So we have to be very mindful about what we are eating. If you look at GM crops, many of them are like genetically modified ever since Monsanto started, and we don't know what, there's a lot of technology involved. Like, in fact, I'll give you an example of something like wheat. Okay, today we have 46 chromosomes, right? But wheat, when it started, had something like 14 chromosomes, like the earlier wheat, which was really coming from Peru or Mexico, and the native wheat, which was really healthy. It had good amount of protein, good amount of protein, good amount of iron. Even if you look at, in fact, you do still get something called emmer wheat sometimes. And if you look at the color of the chapatis, they're almost red because it has a high iron content, or the minerals are good. But the kind of wheat you're getting today is completely terrible. It's so modified that what happens is there are some proteins in wheat. There are glutenins, there are gliadins, there are so many things. So many of these, there's so much of being genetic modification that some of these proteins are recognized by our body as something like self-proteins. Okay, there are some manipulations which happen, and our body realizes that the combination is similar, and they are sometimes taken as foreign proteins also. Okay, so then there's a fight in our body whether it is our own protein or it's a foreign protein, and that starts a cascade of something called an immune reaction, where immune system is about, you have your T cells, you have B cells. In the T cells, you have T helper, T killer, natural killer cells. So you need, in fact, if you look at our bodies, the inhibitory systems are actually more powerful in our body. If we did not have the inhibitions, we would have been going ballistic all over the place. If you look at the autonomic nervous system, it is the parasympathetic which is actually more powerful, which keeps things in control. Okay. If you look at the regulatory, the immune system, if you really study it at a very, very deep level, you will realize that the silencing mechanisms are more powerful and more prevalent in our bodies, were meant to be, because there are so many immune cells being manufactured, and they are so specific for every little thing. They have to identify so many proteins and so many things in the body that if they were not inhibited, our body would have been a riot of continuous immune action. Okay. So whenever you have these kind of foreign proteins which are not aligned with what we are supposed to have, our immune system goes into overdrive. So the T regulatory cells don't do their function. They are suppressed. Then there is the flare up of the other immune system cells, and then there is a fight happening at a very cellular level, at your cardiac muscle level, at your joint level, giving you arthritis, at your thyroid level, giving you thyroiditis, at all possible levels. So if you look at people who are you see more of connective tissue disorders now, it's because of the environment, the food, the water, the habits, smoking. Like if you look at cadmium in smoke, okay, cigarette smoke releases something called cadmium. So now cadmium as a compound replaces zinc in your body. Okay, it's very quick at replacing zinc that is there. So zinc is a very important component of a lot of your reactions for metabolism, something called carbohydrate metabolism, fat metabolism, protein metabolism. So I do not know if you remember your cycles, right, from the glycolytic pathway, Gref cycle, the HMP shunt and stuff like that. We don't try to remember the cofactors and things like that, but zinc is a very important component. Okay, there are a lot of metalloproteins and metallic substances which are very important cofactors. Many times what they do is they help in bringing a certain substance from the cytoplasm into the mitochondria or into the nucleus and stuff like that. So there's a whole transport system going in our bodies all the time. You know, proteins coming here, there, messenger proteins, microRNAs and stuff. So what happens is it's such an important component, it is not there anymore. So a lot of your biochemical reactions which are supposed to be happening don't happen. Okay. So your systems, whether it is glycolytic pathway, where glucose that is taken by you should be broken down for energy, will not happen. So the glucose that is built up, which then will get converted into something called fat, you know, like this excess glucose becomes something called triglycerides. Why do you have high triglycerides? When you're having a high carbohydrate diet, especially when it exceeds 50% of your total calorie consumption. So excessive carbohydrates, which there are more carbon skeletons available. So then the liver starts converting them into fatty acids. Okay, and then if they cannot be utilized because maybe you're sedentary, maybe you're not doing any activity, maybe most people, you know, like there is not enough activity. So what's going to happen to that excess fatty acids? They're going to be converted into something called triglycerides or triacylglycerols. Then they will go and try to, you know, enter the liver. Then the liver says liver will take as much as it can, and then say, now I can't take anymore. You have fatty liver, you have all kinds of problems. So the entire cascade, the normal homeostasis that is normally happening, glucose with this metabolic pathway, fat has to do its own thing. There's something called beta oxidation. Fats are burned down to energy. This doesn't happen because there are blocks happening at every level, just because sometimes of a simple thing. So if you look at something like, there is something called the field of epigenetics, which has really increased in the last 20 years. So what happens is when you have wrong kinds of dietary habits, you have all kinds of bad habits, there are something called epigenetic changes which take place in the genes of our DNA. There's something called single nucleotide polymorphism, meaning just one nucleotide pair gets replaced by something else. And then you have this coding for on the genes, on the DNA, which actually codes for different proteins or different enzymes. So just one switch of, say, arginine instead of thymine changes the entire sequence of the code for that particular protein. And then you don't have that enzyme in your body. And when that enzyme is not there, you're going to have problems. Okay. So you're going to have some disease. In fact, there is a study where they took mice. There was a study where they took men who had a very typical American diet, high corn, high saturated fat diet. And then they studied the sperm. The sperms of these men had epigenetic changes. So they had something called methyl groups added to their DNA. And what happens is the offsprings of these children, if they were female, there were so many epigenetic changes that the offsprings developed something called insulin-dependent diabetes mellitus. Okay, so whenever you have a faulty diet, there are epigenetic changes which cause certain genes to be expressed, okay, or certain proteins to be formed or enzymes to be formed in such a way or not formed that it leads to disease in your child. So we are actually very much responsible for what our children are going to be, or even our grandchildren are going to be. So if you have abused your body with bad food and drinks and smoking, you are equally responsible for the grandchild who develops diabetes in the third generation. So that's important. So mindful eating is extremely important for everything we do. Like, as I said, inflammation is a very big cause. We're having a lot of balance. The balance of omega-3, omega-6 ratio is tilted. We're having a lot of omega-6, especially vegetable oils, which are used. Like if you go to a restaurant, in fact, I feel that every restaurant meal that you take is killing a few of your endothelial cells each time. So, and unfortunately, it's become a trend. You have to go out on Saturday or eat out and things like that. The number of joints outside are just mushrooming, and it's become like a culture. It could have been different. Okay. Now, how do we do planned dietary intervention? What are the principles, especially for cardiac problems? If you have an obese person, the first thing that you want to do is cause weight reduction in that person, because the more surface area there is, the more the heart has to work to pump more blood to suffice for extra tissues, right? And the moment you start reducing weight, the load on the heart starts declining. So the heart learns to readapt itself to a lesser body weight. So definitely body weight reduction is a very important part if you are obese. Again, blood pressure. The higher your body weight, the blood pressure is going to be high, because again, the heart has to contract against a lot of resistance and push to a bigger mass. So your blood pressure increases. So if you lose weight and your blood pressure comes down, DASH diet that we was discussed earlier, it's like basically more fruits, vegetables, whole foods and stuff like that, and less salt. So which was used for blood pressure control. Then something like diabetes. Now it's a topic by itself. I'm not going to go too much because I will not be able to.
Veena,
Yeah.
Just tell us about DASH diet. I didn't get it.
Yeah, it is basically a diet for prevention of hypertension. Okay, it was used. It focuses more on fruits, more on vegetables, more on whole foods, whole grains and stuff like that, and less of saturated fats and less of salt. Okay. In fact, I would add more to it. Now you have something called, if you look at the latest info, you have to have more potassium-based foods and more magnesium in your diet. We do fall very short of magnesium in our diets. Magnesium is there almost in around 300 enzymic reactions in our body. And in fact, magnesium in your diet does help in reducing the blood pressure.
So what food contains magnesium?
Yeah, all your leafy greens do contain magnesium, but many times if you're short of it, there is a supplement which really helps. So I do put a lot of patients on magnesium and find a reduction in blood pressure just by giving magnesium supplementation and high potassium rich foods over a period of time. Then, and of course, lifestyle management. The other things, diabetes again, it's a huge topic by itself, but the mainstay of diabetes management has to be understanding that most people, even today, are only focused about controlling the sugar, which is a very sad state of affairs. It's been carried down over a period of time that they think mera sugar normal hai, sab theek. But if you look at their HbA1cs, they're normally not right. If you check their fasting insulin levels, they're quite high. And they have all the cardiometabolic risk factors, and they're not really controlling the diabetes. And in fact, anytime you have diabetes, you know that there are complications going to happen in the next 10 to 15 years. So at the onset, you have to make the patient understand that you're not treating the sugar. You are treating him to prevent complications of diabetes, both macrovascular and microvascular. You have to sit with the patient and explain to them that this is eventually going to happen. And all these fluctuations that you have, you're going to not pay attention. You eat outside and you think, oh, my sugar is okay. It doesn't work like that. And if you look at most of the youngsters today, they're doing night shifts. In fact, night shift is a separate topic by itself because night shift duty, people are more prone to developing cancer, insulin resistance, all these things. So we have to look at night shift people in a very different mold, and I have to look at them completely differently. Their nutritional requirements and everything changes. So when you look at diabetes, the biochemistry, you're trying to prevent complications of diabetes in the long run. If you're really going to do justice to the patient, you want to tell them, I don't want you to have a complication. I don't want you to have a heart attack in the next 10 years or a stroke or a kidney disease. So understanding that and telling them to control like carbohydrate restriction to a great extent. Today, we have a lot of good keto diet modifications. We have modified, you don't have to be completely a non-vegetarian to follow a strict keto diet. You can do a lot of things. Of course, there is, as I'm discussing lipids, I'll go to lipid management and fat requirements. You have to also understand the need for lipid management. Like when you need to increase your HDL for healthy heart, you need to reduce your LDL, and you definitely want to reduce your triglycerides. So let's start with, in fact, I think most Indians, I find the triglycerides are very high. Okay, it starts with more triglycerides because we predominantly have a high carbohydrate diet. We have, like almost of my patients, they start with breakfast with 2 chapatis, lunch with 4 chapatis, and dinner again with 3-4 chapatis. In addition to rice and potatoes in every bhaji, and there's so much carb. We are literally having 70% carbs in our diet all the time. So obviously, first thing I notice is even if they're not very obese, I do a sonography, I see fatty liver, maximum percentage of lipids. Okay, you will see fatty liver and you'll see a high triglyceride. Then the other thing that you can also do, like if you have the lipid profile, you can know whether he has insulin resistance. The ratio of HDL to TG gives you an idea whether the person has insulin resistance or not. So that helps. Next, what you want to do is you also want to increase his HDL. In fact, unfortunately, I see very low HDLs in most populations. Now, high density lipoprotein, even though there are drugs like fenofibrate, not really effective, not really easy to take. So what you want to do is exercise, exercise, exercise. One of the best ways of reducing your HDL is exercising. When I come to exercise, I'll give you the details on, do I have enough time, Anjali? It's a long topic.
If we can go a little faster.
I will.
Yeah, because I think we've already.
I know, it's already 5:30. Okay.
Yeah.
Okay. So we have to manage, lipid management will be again, there is a lot of controversy on the kind of fats. Today, people are eating less carbs, more fats, but a lot of people doing keto diet. You need to understand the right kind of fats that you have to use even for a keto diet. So if people just go overboard on eating a lot of butter and ghee nowadays, just because some, dietitians say, eat so much ghee, eat this, you have to have the right kind of advice, whether you should be eating those things or not. You have to have all these parameters kept in front of you, in front of your doctor, and then be able to guide that person to what you should be eating and not be eating. Okay. Again, as I said, we are really discussing heart health. So I just wanted to discuss something called myocardial function. Okay, is going to be about ischemia reperfusion, right? When you have a bypass, you're trying to reperfuse. But even if you preventing it is, how do you have a good myocardium? You want to have good myocardium or good muscle cells, which will sustain you in the long run. Which even where there's going to be a good amount of collateral circulation if you do have a blocked artery. See, many a times there are a lot of cases where we go ahead and do a bypass and whatever. There is no guarantee that it's going to really change the scene a lot. There are all kinds of procedures available. But if you're basically in an unhealthy mode, or you're basically heart unhealthy, your heart myocardium is not doing well, your mitochondria are not enough, the dead tissue is not going to kind of, if you had an episode and the area around it is not going to heal properly and not going to reperfuse, it's not going to really help you in the long run. There has to be a way in which you can improve your cardiac function to a great extent. And that actually starts much earlier, before you actually have an event. Now, of course, I want to discuss a little bit about something called these metabolic pathways. So we have two major pathways, something called the mTOR pathway in exercise and the AMPK pathway, the adenosine monophosphate 5-adenosine monophosphate kinase pathway. Now, what is AMP? It's basically a protein kinase. Now, protein kinases are responsible for transferring something called an amino group from one part to another inside the cells. Okay. Now, this AMPK pathway is basically a very useful pathway for a lot of things. Like, let's see what all it does. Okay, so your AMPK pathway is if you manage to stimulate your AMPK pathway, which you can do by certain things like what I'm mentioning here, it helps you to decrease your blood glucose, especially if you're diabetic. Okay. By how do you do that? You reduce your carbohydrate intake. You can go up to just 100 to 150 grams of carbohydrates per day, causing something called hypoxia, which is controlled exercise-induced hypoxia. See, stress, acute stress is actually good for our body. Like when we were hunter-gatherers, when we went hunting, okay, you saw a tiger or you wanted to run. That few seconds of running was actually good for your body. Okay, because it puts a certain systems in charge in your body, which causes better metabolic alterations. Chronic stress is bad. If you're chronically in that state, like if you're in a state of stress for like 5 months, 6 months, even few days is bad enough. So chronic stress is what causes harm. But acute stress is very helpful. So even when you cause something like high intensity interval training, where you just cause some amount of acute few second ka stress, that is going to be helping you to develop your AMPK pathway, which is a beneficial pathway for health and better health span. Something like fasting. Okay, fasting again is very much in vogue. Definitely do it. Intermittent fasting, whatever 14 hours, 16 hours, whatever window period you want to do, fantastic. Because what happens in fasting is, earlier we did a wrong thing of saying that constantly keep eating. But what happens is every time you eat, you're causing an insulin surge. So we are already suffering from a whole epidemic of insulin resistance. So you want to keep your insulin resistance in control. So what happens is every time you eat, it could be just a small gram of sugar, 1 gram. It is going to cause a spike in your insulin. Okay. You don't want your insulin rising up every now and then, because the moment your baseline insulin is high, the body is going to go into something called resistance. You have too much of it, the body is not going to function properly. You want to bring your insulin levels all the way down. So keeping a gap helps. Okay. So the more the gap, even between meals, if you have like a 4-hour gap between 2 meals, nothing in between, not even like a green tea, like your stomach should be completely empty for those 5 hours. What you're doing is you're causing insulin sensitization. So a 12-hour fast minimum, definitely go to sleep, go have your dinner at 8 o'clock, get up at 8 o'clock. That's a good 12-hour fast. Give rest to that part so that your pancreas is not constantly throwing out insulin. So you have to increase your insulin sensitivity, which is a very important part. It also helps in your AMPK pathway activation. Also helps in prevention of cancer. Metformin, again, metformin is a very good, useful drug. It's being used as a longevity drug. A lot of scientists are using metformin on a very regular basis, primarily because it insensitizes your insulin cycle. Again, polyphenols, all these resveratrol and supplement. Now, in fact, you get red wine. You can't really have enough red wine. You need at least 1 gram of resveratrol, which will not happen in a glass or a 2 of red wine. There are supplements. Not that it's bad. You can have your red wine. But yes, you need resveratrol because they're going to help you in improving your oxidative mechanisms, your antioxidant mechanisms. So that's going to help you. You have something called phase 2 detoxification pathways in the liver, which helps to remove all the bad stuff, all the toxins and, the chemicals that you're eating from food, from atmosphere. So you need to improve your phase 2 detox pathways. So these are the polyphenols, the bioflavonoids are going to help you to improve that. Even something like CoQ10, your quinones, okay, or ubiquinone. Ubiquinone, there is a huge cycle of ubiquinone enzymes, which are like chaperone proteins. They actually remove the bad substances. In fact, if you look at our metabolism, we have a lot of proteins. Most of your enzymes and everything, carrier proteins are all proteins. So what happens is proteins are they have all kinds of different shapes. They are in the form of sheets, they are globular, hemoglobin is different, your cartilage proteins are different. So there are different kinds of shapes to a protein. So when a protein is utilized, what happens is it gets degraded and sometimes its shape is altered. They are misfolded, they change, they become something else. So these misfolded proteins are actually bad. That is where something like Alzheimer's starts, or your Parkinsonism starts, or your brain problems. Because if you look at there's something called tau proteins, or you have amyloid fibrils in your brain. So whenever proteins are not sort of removed properly from your system, they're not thrown out in the right manner, they are misfolded into different forms, and they are physically present there. They form something like amyloid tissue. And that can cause dementia, Alzheimer's, and a lot of other problems. Similarly, in other tissues. So there is a system which is like the chaperone system, or there are something called proteosomes, the phagolysosomes, which actually digest these proteins, and they use they throw away unnecessary parts and they recycle the amino acids to make better protein. So you can continue with the process of new cell formation. If you look at our skin cells, our intestinal cells, there's a need for a lot of new cell formation. You need to recycle this protein, especially if you're inadequate in your protein intake, you're a vegetarian or a vegan, you need recycled proteins all the time. So you need to have a diet which is healthy, which enables your recycling protein mechanisms to keep going smoothly so that new cells are constantly being made. Okay. Then there are things like even all these things are the antioxidants which help you in the pathways of renewal. So again, even berberine is very useful. You have curcumin. Now, curcumin is there in your turmeric, but it will not get absorbed the way it is which we use in food. You need something called piperine along with curcumin to get absorbed and be bioavailable. So piperine is something which is there in pepper, or you have, and even then it is not really bioavailable. You have to have something called nanocurcumin. So this combination, when you're more aware of it, like there are patients where they have a high risk of CVD, or they have cancer risk, or we can do a genetic testing, find out what is the potential for having something. You can give them even these kind of supplements, which are really helpful. Again, ALA, especially alpha linolenic acid, which will get converted into your omega-3 fatty acids. Okay, again, food may you want more of omega-3 fatty acids, have more of fish oils. If you're deficient, you're not having enough, you have to have your regular intake of EPA and DHA, which also is actually very useful in a lot of mental disorders. Today, serotonin that is released, even from the gut and the brain. You have something called the gut-brain axis, and you need a good amount of EPA and DHA to actually form serotonin at both presynaptic and postsynaptic junctions. So having a good diet is also very relevant to having a good mental health. So in fact, many insulin resistance again is responsible for causing anxiety, bipolar disorders, depression, and things like that. So when you alter the food, you can have a lot of improvement in mental health problems. And if you work together in improving the nutrition and lifestyle methods and psychotherapy, it can really work beautifully to alleviate a lot of mental health issues that we are seeing in young people nowadays. Now let's go to exercise management for heart disease. Basically, there's something called speed intervention, which is using either sleep, emotion, exercise, and diet. I think sleep and emotion has been covered. Sleep, I will go a little more in detail. There is in fact an Indian scientist called Dr. Sachin Panda who's done a lot of study on the circadian rhythm. The circadian rhythm is something which we had always, where we get up in the morning with sunrise, go to sleep at sunset, which was actually a very beneficial thing, because what happens is when you're sleeping, you have the release of something called melatonin, which is a very good hormone, which helps you to sleep better, which is responsible for causing more growth hormone release for IGF. So you are actually growing in your sleep state, especially from the time from 10 to 2. So from 10 to 2 is a time when GH is released, when melatonin is released. If you do that, then cortisol goes down. But what is happening nowadays, you sit on Netflix, you watch a movie till 1 o'clock in the night, no melatonin. You don't go out in the sun. In fact, melatonin is secreted. There's a subcellular melatonin coming from the retinal cells, and there's one which is coming from the pineal gland. It's in fact secreted by exposure to the sunlight. You go out in the sun, even if you're in a car, you have exposure for at least half an hour to the bright sun, you are going to secrete melatonin. So melatonin rises in the night. So it is there, it is secreted in the daytime, and it's very helpful to give you a good refreshing sleep. In fact, it is a time when you want to regenerate. It is a regenerating molecule. So all these things are not happening. We are staying up late, we're doing night shift duties. In fact, all night shift workers, you have to give them melatonin, because the chance of developing cancer without the fluctuations of melatonin is going to be very high in night shift workers. So it's very important to pay attention to their dietary habits, to their activity levels, how they are managing all these things. The other thing that, again, as I said, as we grow older, aging decreases our mitochondrial function. Okay. So we have to preserve mitochondrial function. So how do we preserve mitochondrial function? Again, as I said, stimulation of lifespan genes related pathways. There are something like the AMPK pathway I discussed just now. You have the insulin-like growth factor. There's something like sirtuin. Now, sirtuin is a set of proteins which are released when you have certain food substances, something like broccoli sprouts, when you have some cruciferous vegetables. Now, sirtuins, when they release, they cause something called stimulation of the NERV2 pathway. It's called neuropeptide endoscopy respiratory factor 2 pathway, the NERF2 pathway. Now, this in turn stimulates a lot of antioxidant enzyme system pathways, like a glutathione synthase, and it really potentiates these actions. And that's how they clear up all the unnecessary elements, the ROS, the reactive oxygen species, that is the end product of bad metabolism, and it's all removed. So you have to have these things happening all the time. You keep eating food, downloading, but you have to have a way of removing it all the time. You have to have like that Ghanta Gadi coming in and taking a kachra, like that's what it is. So you have, in fact, there are some genes like called, I do not know whether you're aware, they have done a study in centenarians. You have these blue zone areas where Okinawa in Japan, and you have certain areas, there's Sardinia in Italy, where they found these centenarians who live up to 100, live a very healthy life. There are people who are 100, 105, and they go cycling and do all kinds of activity. So they found 4 important things which kept them so healthy till that age. One is they had, most important, surprisingly, social connectivity, which they kept going till the last day of their lives. Second was they have a very high incidence of something called FOXO3 gene expression. Now, FOXO3 genes are the ones which are longevity genes. They're called, I mean, I don't want to go into this because I have already given that talk some time back on longevity and health span. So there are a lot of these longevity genes which help in, like if you look at aging in epigenetics, it's a set of different things. It's telomere trimming, it's DNA malfunction, it's mitochondrial malfunction. All these things are happening at a very cellular level. So protein misfolding, all these things. So when you have an increased expression of something called FOXO3 genes or the longevity genes, these things don't happen. So your DNA is preserved. When your DNA is preserved, your telomeres are retained. Your telomeres don't keep getting shorter and shorter. That means these other pathways, for health span pathways, are initiated, and you have a better and a healthier life. Okay. The other thing is something like mTOR. Now, this is called mammalian target of rapamycin, which is another pathway, which happens especially when you do resistance training. So it is basically an anabolic pathway. You have more muscle, you want more muscle, you want to stimulate the mTOR pathway. Doing weightlifting, you want to stimulate the mTOR pathway. So this pathway actually causes a lot of protein synthesis, protein redirection, and refold. It sort of puts proteins in the right state, and it causes hypertrophy. But too much of stimulation of the mTOR pathway. If you look at most of these people, young boys gymming, they're constantly doing only weight training and then, constantly stimulating the mTOR pathway, which is not good because again, it can have a lot of mitosis and propensity to do towards developing something like cancer. So you have to balance your exercise between AMPK pathway and the mTOR pathway at a genetic and a cellular level. Okay. So how do you, again, now let me come to the real basics of a cardiovascular exercise program. Now, mostly what we do in giving a exercise therapy for people, either to prevent cardiovascular disease or at high risk or having all these kind of metabolic disorders, we calculate something like a carbon formula, which is 220 minus age. I've just taken an example of 20 for ease of calculation. So you have a 20-year-old man, his maximum heart rate will be 200. Okay. Now, there's something called heart rate reserve, which we calculate. It's MHR minus the resting heart rate. So if your maximum heart rate is 200, you have to calculate your resting heart rate when you're sleeping. Like you can have a lot of monitors and you can figure out, you can ask somebody to check it. So assuming as resting heart rate is 70, it becomes 130. Now there is something called heart rate zones when you have to decide how the person is going to exercise. So your zone 1 is the first zone, which is around 50 to 65% of your heart rate reserve. So you can calculate. For in this case, it will be like 65 to 70 beats per minute. So zone 1 is a very light, mild exercise. I mean, somebody who's extremely sedentary, who's not done anything, you want to initiate an exercise program, you have to start him with zone 1. Okay, because the heart is not adapted yet. So you have to progress, you have to do progressive training for adaptations for aerobic mechanisms, anaerobic mechanisms, and everything else. So then that's the zone 1, where it's 50 to 65% of the HRR. Or many a times we calculate something called 50 to 7, whatever the percentage of just the maximum heart rate. But HRR is a better indicator for heart patients. Then you have zone 2, which is another 10% increment in the percentage, zone 3 and things like that. Now, zone 3 is a little difficult. That will be like real running and bicycling, at a higher pace where you feel breathless. There is something called rate of perceived exertion, RPE score. So there are scores from 1 to 50 based on how light or how, like it starts with very light, no exercise, very light, slightly higher, moderate, heavy, 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 heavy. So you can decide between RPE, the rate of perceived exertion, and decide how between zone 2 and zone 3 and plan out a routine. You can do it yourself if you understand the dynamics of these things as doctors and figure out what kind of exercise is right for you, how you need to progress in your own individual path. So that is what you can do. So in fact, most of the time, if there are high risk or metabolic disorders, you don't go to zone 4 is zone 3 and zone 4. You're somewhere between zone 2 and zone 3. So most people, especially doctors who are interested in doing exercise in a very planned manner, you can start off like this and move progressively. So those who are elite runners and marathoners and all that, you can push yourself a little bit for zone 3, zone 4. But in fact, even in runners, many a times you find a lot of runners dying on the treadmill and things like that. Many a times they're not aware of the risk factors they have. They've not been evaluated adequately. The diets are very inadequate. At the same time, another thing they have to remember is exercise is stress for the body. Whenever there is chronic exercise, it's stress. When you're working out for more than 2 hours, 3 hours, running marathons, it is a stressful response. Human beings were not really running. We had short sprints. Whenever we were hunter-gatherers, we did not run continuously for 1 hour, 2 hours. In fact, that damages your joints and stuff like that. So you have to figure out what is right for you. So a short burst of exercise is very good. It restores your balances. It increases your AMPK pathway. It kind of really rejuvenates and regenerates everything. So you have to change the way you exercise. Even if you're young, you can think about these things, whether there are any incidents of heart disease in your family, being aware of it. In fact, we do a lot of genomic mapping. You can actually do it. Map My Genome is there. You can send your sample for testing. It hardly costs around 12 to 15,000 rupees. You can find out if there's a very strong family history. In fact, I recently had a person, there's a very strong history of Alzheimer's. And that person was very scared because he's seen his father in a really bad shape, can't remember anything, and it's really pathetic. So got his testing done. He has very high incidence of ApoE, APO4 variants. Definitely he's also going to get, like if you have that, 80% chances you will also get Alzheimer's or dementia. So if you're aware of it, you can start preparing, planning for it, whether it is legal issues, talking to your children, setting everything right before something happens to you. You can even, divert your funds into some caretaking for yourself as you grow older. There are a lot of implications. So understanding your genetic history or your genome patri is going to help you to decide how you're going to live the rest of your life or how healthy you want to be. And a lot of changes can be done according to that. The other parameter that we use is something called VO2 max training, which I do a lot of times. VO2 max is VO2 max, as the name suggests, is the amount of oxygen that your blood can, that your tissues can pull out from the blood. Okay, how fast they can consume the oxygen that is there. So normally in a sedentary man, it's around 35 to 40 ml per kg per minute. In a woman, it's 27 to 30. So the better the VO2 max, the better your cardiac status. That means your body has the ability to immediately pick up the oxygen from the blood. So there are algorithms. I use an algorithm for understanding the VO2 max. I calculate it. And then even if a person has a very low VO2 max, I try and give him enhancing exercises where he reaches a certain, at least the average that is meant for him. In fact, recently I had a patient who was a diabetic and with one or two blocks. And she had a VO2 max, which was really very, 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 very low. It was almost like 15. And and she used to go for a walk on a regular basis, and her BP used to shoot up to 220 when she was doing that work. So we sat down and I had a programmed. I sat and made her do the exercises. We did a 1 mile walk test and monitored her right from the ECG to the calculation of the VO2 max to her heart rate and everything. And then we realized it was very dangerous for her to go for a walk on her own when she was doing it. So once we had the parameters, I had her heart rate zones done. And I had to, tell her to invest in some way which she could monitor her pulse. And then she could use those parameters to monitor her own exercise even when she was going out on her own. So we did it for around about 4 weeks. And once we knew and we had the confidence, and slowly her VO2 max started improving. And then, her training zones started getting better. Now she can safely do around 5-kilometer walk. In fact, she was on 100 units of insulin. Changing her diet brought her down to only 25 units of insulin to that extent. So she's lost around 15 to 20 kilos. She's much healthier, much better. In fact, her son got recently married from USA. She's in a very happy place. So you have to I had to sit and really convince her and tell her what could be done. What was a range of things that she could actually do with her life. So she was very happy recently. I think in April, her son got married and she really managed to do it beautifully. Okay. So again, resistance training, again, I would say, this was an aerobic component of exercise. Resistance training, building muscle is extremely important, especially if you are a diabetic, because it causes something called an increase in your GLUT4 transporter molecules, which allows the glucose to be absorbed faster into the muscle, and it will improve your glucose control, and it will definitely improve your insulin resistance. A lot of mechanisms involved in resistance training you have to do, especially in senior citizens. I see most of the time they are unable to do basically activities of daily living. Like sitting on the floor, sitting on the pot, getting up from sitting to standing position. So what happens here is your muscle mass starts declining with age. Every year, your muscle mass is just kind of, getting lesser and lesser and lesser. And we don't pay attention to it. A lot of emphasis has been on the aerobic component of working out. And we don't pay attention to muscle building. So if you're growing older and if you want to improve all these daily functional activities, you have to focus on all aspects of exercise, strength building, aerobic, flexibility, yoga, because I realize that many of the times we don't even use any of our spine muscles, like it's completely unused. A lot of the back muscles, you're not even using them. So it just, use it or lose it. It's not going to be there for you. And even balance related exercises, as you grow older, your balance goes for a toss. You have to figure out on how you're going to work on this. So a lot of things that are doable. Even dance is a very beautiful way of bringing balance and strength and cardio into your routine. Do what you like to do. You don't have to necessarily go to a gym. You have to figure out a way of how a lot of activities can be incorporated into your daily living. So you can become your fittest, best self. You don't have to rely on anybody. You don't have to be a liability on anybody. You can do all your things on your own till the last day of your life. Again, as I just normally, there are a few, as there are a lot of doctors, I do not know from different professions, we do a few predictive biomarkers for CAD. I always do a fasting insulin. Homocysteine, again, is why it's important is excess homocysteine is a sign of a lot of things. It means that methionine is not being manufactured in the body. Methionine makes thymine. Thymine is the base pair required to make more DNA for making new cells or regenerating cells. And that in turn is important because that whole cascade of DNA methylation, I'm not going into that, means that you're going to have problems. So you have to bring down the homocysteine level. Supplements are there, bringing it down. Foods are there for doing all this. Because again, it's a risk factor for heart disease. HSCRP. HSCRP, regularly, if it is high and you're aware, in fact, a lot of chronic infections after COVID, we have seen a lot of high rises in HSCRP, but if it's there specific for heart, work on it, try, and there are a lot of anti-inflammatory foods, supplements, a lot of things can be done, bring it down. But there have to be some fixed targets. because you cannot just go in a random fashion and give exercise prescriptions. I prefer some fixed targets. So I use a few predictive risk factors, and I like it when I bring the HbA1c down to, say, less than 7. I do lipoprotein A for a lot of patients who are obese and diabetic, and I do find that it is high. And when I do this, it's like a reference frame, and I put them on an exercise and nutrition protocol, and I'm looking for parameters. I do want some of these parameters. I'm not interested in looking at blood glucose going down. I'm interested in looking at HbA1c going down, HSCRP going down, homocysteine being normal, lipoprotein A going down. So that's how I look at all these parameters. And I think there's a huge topic, and I try to do as fast as I can. Thank you very much for a very patient listening.
Thank you, Beena. Thank you, Beena.
Beena. Thank you very much. Manveen, are you there? I don't know whether Manveen has
Yes,
been.
ma'am. Yes, ma'am. I'm there.
Yeah,
I had lost network in the middle because of the power network.
Power outage.
Thank you, madam, for the lovely talk. And it's amazing to know how much we can achieve by just changing our diet and lifestyles with these small modifications. Madam, are we taking questions?
Yes. There was a question, and if anyone has something in between, please do ask. But I got a question from one of our viewers, and just a minute. Can you ask it? Can you ask it?
Sybil had asked.
Asked about fruits.
Yes. I think he's asked, does food consumption affect the triglycerides?
Yeah.
Beena.
Okay. See, the thing is, sometimes I feel there is no need for taking excessive fruits. Fruits are basically fructose. It's finally a sugar. Only if there is a fruit which has a lot of fiber, it will help you. But no, fruit consumption, basically it's carbohydrate. See, the body doesn't understand that this is a fruit or this is a rice or this is whatever. Body only understands carbohydrates. It's broken down into simpler sugars like glucose or whatever. So like you have to figure out whether there are people who take excessive amount of fruits, not required at all. In fact, it is not needed. The present criteria is you don't really need to eat so much. If you have to eat fruits, eat the good ones, which are going to help you, like the berries, the citrus fruits or the berries. Definitely a better option. And then in that also we kind of sort of sort it out for individual patients. What can be done? Who needs what based on their requirements. So I mean, generally you are aware of what fruits contain what particular elements, and then I know a person needs a particular thing, I prescribe it in that fashion. It's not required, not really needed to extent.
Yeah, does a heart disease patient also have a lung disease? So would you say it goes hand in hand, heart disease and lung disease?
Yes, definitely. It depends, because sometimes if you know that heart disease can also cause lung function, it's like both. It depends on the kind of lung disease. You can have something like cystic fibrosis and then later develop heart disease. It happens. At the same time, there are a lot of we have to work differently for both conditions, because it becomes a real challenge where you have both combinations. So we have to figure out the predominant disease and then work towards building. I completely missed talking about pranayam and meditation, because if there is a combination, I work first on developing respiratory function. And it really helps a lot. In fact, even in terms of nutrition for respiratory function, I had done this where we have a lot of patients in ICU and we don't even focus on the nutrition, because the work of breathing of the respiratory muscle itself is so high of a patient on a ventilator. We don't pay attention to it at all. So when you have even a respiratory case, looking into the nutrition and what all they need for better lung function and all the exercises they need, I see a small change. Then it's a stepwise progression, how to go about it. So right from whether it's bronchial asthma or other congenital diseases and heart related functions. So it's a personalized thing that you need to keep working
on. And I think that the viewer has also asked, what about life after angioplasty or a bypass?
Oh yeah. I think after a bypass, you have a whole lovely, beautiful new heart. So you are back to, like you can do anything you want. Of course, initially, depending, there are patterns, like according to American College of Sports Medicine, ACS, we have guidelines. We start with 4-week, 8-week patterns. And when like using these same parameters, whether it's HRR or VO2 max, we can bring the person back to complete function or even better function. When there is a stent or something, what happens is there are Other things we also take into consideration because the person might be on a lot of medicines. You have blood thinners, you have, there are other vessels which might be blocked, which are not taken into consideration. And again, looking at myocardial function at a mitochondrial level. So you can work out. It only just when it is like a guided program, when you know what all is happening, and you have to give certain monitoring systems to the person, and they can work. It's difficult for them to work on their own post that, but if they're under a supervised program and it takes a little time, like I said, in this lady, I had to give her the kind of parameters she needed if she was doing it on her own. So you have to have the faith and confidence that you can do it on your own after you've done a supervised exercise program.
So cardiac rehabilitation.
Definitely, very big part, very big part. There's no need why anybody should be completely sedentary or bedridden. If you've got a completely new vessel.
We have a very good friend who had a bypass and who did, Himalayan base camp. So,
yeah.
So that's very heartening, and so the person just waved. So life after. You want to say something, Shailesh? You have to unmute yourself.
Veena, thanks for a very nice talk. Absolutely fabulous. Only one question I wanted to ask you. Talked about muscle strengthening. You talked about yoga. You talked about stretching. You talked about long runs and short runs, VO2 max. But we have hardly 1 or 1.5 hours per day of doing these things. And to combine all these things is very difficult. Either we go ahead with the muscle strengthening, or we go ahead with the long run, or we go ahead with some yoga, stretching and breathing. All the things together doing in day-to-day life is very difficult. I'm doing it, so I know what it is. And if I chase the muscles, I can't run. And if I chase the running, I can't build up the muscles, and then the nutrition is that state. So it is all haywire. So can you give few ideas to how to go ahead and do the things properly?
Definitely, definitely. See, the thing is, you have to incorporate everything. You don't have to do muscle strengthening every day. Even if you go workouts 2 times a week, it's more than enough. You can divide into upper body and lower body, right? In fact, the more rest your muscles get, the better they become. They need at least 48 hours of rest between workouts, so that they actually regenerate. Muscles become bigger when they are resting, not when they are actively contracting. So you can do, say, twice a week, you can have your muscle building exercises. In fact, now what I forgot to talk about HIIT, high intensity interval training. You don't have to do continuous aerobic exercise on a regular basis. HIIT is a big boon for people like us who don't have time. So there are lots of regimens and proper scientific regimens called the Tabata regimen, and a lot of other regimens are there, which were initially started on cyclists and things like that. So you can do something like high intensity interval training, which is just like 30 seconds of high intensity, where your heart rate goes up to 70% of your HRR. Then take a break of 30 seconds. Okay. Or depending, you can take a longer break. You just have a high intensity episode of, say, 30 seconds. You can even rest for 1 minute, 2 minutes, whatever your capacity. Recover from it, then have a second bout of the same or any other. You can have either running, sprinting. For those who are like sort of fit, like you can't have it for problem people. But if you are like generally, if you're around 50 and you've been doing a lot of exercise and you're kind of fit, you can incorporate even 10 minutes of HIIT in your daily routine. It hardly takes any time. So even if you're going for a walk, a regular walk, say half an hour walk, you can take out 10 minutes to do an HIIT in the process of the walk. Like I do that most of the time. If I'm walking for half an hour, I'll take 30 seconds run, 1 minute recovery, again a 30-second run. So 5. So you're totally running for only like 2 minutes, high intensity run. So you can do that. That's a very useful. You can do HIIT exercise even in your home where, and that also you need to do only maybe 3 times a week. So just 10 minutes, 3 times a week. Okay. And muscle building 2 times a week. Yoga, I think more than you can devote time to yoga, because it's a slow process. You need to be there. If you can do it maybe twice a week, it's great. But I think even in your everyday life, we have become a little lazy in terms of like getting up again and again. The doorbell is ringing. You want somebody else to open the door. So even if you become very proactive, constantly getting up, doing that thing, go up, like what I do is like in fact, like this webinar, if I'm listening to another person's webinar, I'm sitting here, every half an hour, every 15 minutes, I take a break. I will just go out, do something. I have a resistance band lying next to me. I will do a few exercises. So it's not that we feel that, oh, I have to sit continuously. You can use a dumbbell. I can keep a dumbbell right here. Even as I'm talking, I can, like do some exercises right here. So, and if you, even when you're working, you can have a standing, you don't have to have a sitting, station. You can have a standing station, do a few squats as you're working. In fact, nowadays, during COVID, my advice to most of these people who are doing working from home, don't sit for 8 hours at the computer, or even the students. Have a standing station. Every half an hour, get up, do 5 squats, come back, do that. If you can do the squats as you're working also, like it's like that. So you have to incorporate days of activities of daily living into your routine now. And it is up to you to what intensity you want to do it. You can do it higher. You can build, you can keep a heavier dumbbell. You can do all kinds of things. So it just becomes a rotation thing. And it'll come to you. Once you start doing it, it becomes a part of your life. It's what's happened to me. So it's a constant process. Like try and sit down on the floor as often as you can, because you're really working those muscles. You don't have to just definitely really go and do a leg press in the gym, but you like do those things more and more often, your muscles start adapting. So that's how to go about it.
Thank you so much. It was excellent.
Any more questions? Anyone? Archana?
No, thank you. Everything was extensive and nice.
It was too extensive. I'm sorry for that.
No, it was nice. It was informative. We needed it.
Manveer?
So that brings us to the end of our wonderful webinar. It truly enriched our minds and hearts as well. So I would like to thank our all 3 speakers, Dr. Beena Aputkar, Dr. Suresh Patil, and Dr. Rajiv Sharma, for sparing their time and sharing their knowledge and wisdom with us. I would like to thank the audience for tuning in and making this webinar a success. And also I would like to thank Palghar Academy of Pediatrics, Dr. Anjali Gokarna Madam, Dr. Vaibhavi Barot Madam, Dr. Joshi Sir, Dr. Joshi Madam, for being there and for taking the initiative to organize this webinar on the occasion of Doctors' Day. And I'm sure everybody who's attended this, they have gained a lot of information and how to make these changes in their day-to-day lifestyle to become healthier and fitter. Thank you, everyone.
Thank you. Thank you from the bottom of my heart, Dr. Rajiv Sharma, Dr. Suresh. It's been so valuable for us and so much information. And we are going to go through the slides all over again. And if you can share your slides as a PDF, we'll be grateful to you. And I'm sure everyone is going to start exercising in any small or large way that they can. Even if it's for 5 minutes, and sitting is the new smoking. So we have to make standing our station. And I think Dr. Hemant Joshi, Archana Joshi have always set an example. And Dr. Hemant Joshi, you want to say something?
Hemant, you want to say something? Yes.
He has told us.
Yeah, it was quite inflammatory, and I hope it ignites minds. And we all give a standing ovation to our speakers, and stand every day, all the time.
Thank you. Thank you so much.
I luckily practiced all my life standing in the clinic, and it helped.
Yes.
Thank you.
And so let us all live till we are 100, and let us follow our eye, and let us be healthy.
116 वर्ष जगू आपण सगळे.
116.
Yes.
Thank you so much, Beena. Thank you, Dr. Raj.
Thank you. Thank you so much.
Thank you
for the
everyone
speakers
on
and
this
the lovely
webinar.
audience.
And next week we meet and we're going to discuss about environment issues. Thank you, Vaibhavi. Thank you, Shailesh. Thank you, Archana, for hosting this. And next week we meet for environment. And we have 2 great speakers, and we'll be sharing that as well. Yes, Dr. Hemant.
Yeah, last year and a half, every Wednesday, you have enlightened us. We are grateful to you. Thank you
so much. Thank you.
Sir, it is a teamwork, sir. You are also included.
Yes, and they are the hosts.
Yes,
yeah, and they lead from the front. So they teach us all that we have spoken today. They do it themselves. So we have them, and thank you, everyone. We meet again next Wednesday. We'll share the link with you. Thank you, Manmeen, for hosting this. Thank you for being moderator. I can see your daughter impatiently waiting behind you.
Yes, they are both around me now.
So thank you, everyone, and we meet again.
Thank you.
Yeah, thank you.
Thank you.
ते रेकॉर्ड करायचं हार्टचं खूप चांगलं होतं. युट्यूबला जाते 6 वाजले रे. 6ची बस. ती आली आता.